My Yeah, I'm fine with George. My youngest son was an oops baby. I didn't want to have a child until I was 30. And when I did become 30, I thought, you know what? I I want a little girl. I let him convince me to go off and um got pregnant and had a miscarriage very early on because of Depakote. I was still, I think, it was like in between the first and second trimester. So early, it, they said it'll be nothing but a heavy period. Yeah, no, it was
Mm.
more than a heavy period. And I cannot imagine getting an IUD. You are brave.
I just
I
don't know if
have
it's
the
gonna
arm thingamabobber. Actually, you could see it maybe. It pokes.
Mhm.
So for this pregnancy, I know you mentioned oops baby. Was that the one when you were on the Depakote?
Yes.
Oh, okay. So no medical professional would have,
Wait, no, I was
went
not on
over.
Depakote for him. I didn't get on Depakote until after I was on the seizures. I had at that point I was on Adderall and give me a moment. My dad's calling. Yes.
Okay. So yeah, that would definitely be concerning. Depakote is one that's very well known for significant risks and potential harm to the developing fetus. That's pretty much where we ended up with the Carbatrol when I was on Carb. Yeah, it was definitely Carbatrol, the extended release, and that's well known to reduce the efficacy of Depo, and that's pretty much what my conclusion was led to that ectopic pregnancy.
I was on Keppra when I had my kids. They said that that was the safest one of all the meds for having a kid. And for my first kid, they said I couldn't breastfeed. And that was in 2011 because of the Keppra. And then when my daughter was born in 2014, they said that I could. So I don't know if it was different doctors or different research came out in between there where they were like, okay, it's safe now. But I don't know. That just shows you how it changes their information throughout.
Yeah, and it's not uncommon to hear that doctors change their recommendations.
Mm.
Sometimes due to anecdotes, how the patients they've treated, as well as research that's being done. So the Keppra, though, that's one of the ones that's known for kind of a standard higher dose. Did your dose change in between
I was on a low, at that time, I was on a lower dose.
in 14?
Uh, yeah, I would think I was taking like the minimum dose really, and it was controlling my seizures. They've just, as I've gotten older, they've gotten a little bit worse and worse. A lot of my problems when I was younger was like missing meds, drinking. So then I quit drinking, and then I stopped missing my meds. I got religious about my meds. And then I was like doing all the things that were like taking care of all my triggers. And then, like, within these past 3 years, my seizures have gotten really bad. And it's definitely because perimenopause. Like, I was having maybe one seizure a year. On a bad year, it'd be like two, but usually that was because I didn't take my meds or something dumb,
Yeah,
just being a dumb epilepsy person. And
it happens.
but now I'm like religious about everything, and I just keep having more and more seizures since 2023.
Anyone ever
And
mentioned medication resistance to you?
no, because they're all pretty much they're related to my period. They didn't diagnose me with catamenial. I can't say that. at the beginning, but they and even one of my doctors was like, "Oh, that's not a thing." And I was like, "You're dumb. I know it's a thing, but whatever." And then they were all related to my cycle. Like you can just tell like
Yeah, once
and
that trend is established, it is frustrating though how once that trend is established, the doctor will write off any other triggers. That's
mm,
where I feel a lot more emphasis than should be is placed on catamenial seizures when obviously there are still other triggers. Maybe the that time of the month, the day, couple days before and couple days after is when my threshold is lower. You know, that was a stupid day to drive into the mountains, but we did. And that's why I don't call last week's tonic-clonic just catamenial. You know, usually I would have focals. I'm more likely to have focals around those couple of days. It wouldn't have completely generalized on, you know, pretty much any other given month. So that's what has me curious too when I go to see a physician. I think we should all ask more, you know, almost give them the hypothetical situation. Do you think I would have a seizure if, you know, and then we'll bring up the that time of the month and travel or something else and see if the doctor would be so quickly to write it off as, oh, on that time of the month, just don't travel. Or if they would come up with a suggestion of working with your hormones. Some of the doctors are saying that influencing hormones by, you know, taking other supplements really do make a difference. And they mess with that AEDs and benzos so much. I'm surprised they don't really try to get to the cause and work with those factors more frequently.
my doctors typically write me off when I talk about my seizures being in accordance with my periods. They're just like, okay, whatever, and then just move along. Um, we're military, we move around a lot, so I don't always have as much choice in my doctors who they are. And but I will say, well, I just have tonic clonics. That's what I get. And I haven't had my period in 2 months, and I haven't had a seizure in 2 months. So that's kind of crazy.
And you can show them like the tracking that it like matches up with your period and the seizures, and they still are not believing you.
Hi,
Um,
friends.
they just blow me off all the time. Doesn't matter what I say. I have a bad doctor and I'm getting a new one. So I just have to wait a few months to get to see.
Yeah,
But
no, I believe you. My first two neurologists are horrible, but
yeah.
I mean, with the move and everything that's going on, that's what's got me committed to actually finding an epileptologist. Never had one of those before. I'm
Okay,
thinking
I'm
somebody
so
who's
sorry
actually a
about that.
specialist. They might know what they're
I
talking about.
cannot. Hi. Hi.
Hey, Hannah, can you hear us okay?
hi.
Yes, now I can.
Excellent.
Didn't know things like this were out there. I fucking love Reddit.
Beautiful. Well, this is the first event. Just so you know, you are definitely in the original crew here.
Oh, cool.
But
Um,
not gonna be the last.
I had
Exactly.
I've never really been in anything like this before, but I heard um kind of what you guys were talking about, that you were being blown off. And my when I was diagnosed at 14 years old. Actually, no, wait, was it? It was puberty. It was puberty. That's when I was diagnosed. And that's when that was the worst of it. And then it always was with my cycle, and typically at night, things like that. Got the whole SUDEP thing, and they're all the tonic clonics. But from there, I I started researching medical things a lot because of all of that. And then I ended up going into nursing. So I'm a nursing student at the moment. Um, but from what I've found in the research is that there's so little that they know about what causes the seizures. Most of the time, they can't even figure out what's causing that seizure to happen, what effects the seizures are having on the brain. So the doctors, I think, because they don't have the knowledge, they can only do so much, that it sometimes comes off and some doctors are just assholes about it, and they're just like, all right, you're wasting my time, like I have another patient that I need to see in 10 minutes, get to the point. But I think that because there's just so little that they know that is known, and so little that they can do, they don't even know how these how the seizure meds work. They don't, any of the seizure treatments, they don't know how they work. They're throwing stones at a wall and they're seeing what hits. So, I mean, it took me a long time to get over that too, because I thought that I was not being believed. And that was a big trigger point for me for a long time. But the deeper I got into the profession, it kind of just helped me not take it so personally.
Well, and
That's powerful.
the doctors, and I think especially the neurologists, they come off as so arrogant, and I think they might be very arrogant, and they have such a hard time admitting they don't know everything. And this one neurologist I went into, I came into her with a cup of drippings from my nose, the CSF drops, and from the ENT doctor that I had been to the day before. He told me to bring him into the neurologist. She refused to test them, and I started crying. I knew I had a CSF leak. She refused to test them. I started crying, and I was in there with a friend. And she said, and she was caught off guard. She's like, why the F are you crying? She didn't say that, but I could tell by her face. And so then she looked at me and she said, I have never heard of she asked me questions. She said, did you bonk your head? Do you have a skull fracture? And I said, no. And she said, I have never heard of a spontaneous CSF leaking out of a nose if you don't have a skull fracture. And then we went through the rest of our appointment, and she said, this was May. She said, I'll see you in August. And she scheduled me for an August appointment. I had in my chart, I had in my chart that the next day the ENT doctor had scheduled me for an MRI an MRI for a suspected CSF leak. She did not even look in my chart.
I think there's something about medicine and healthcare as a profession that brings out the assery in everybody. Like the asshole tolerance, it just drops for some reason. I don't know. I mean, they're throwing my epilepsy doctor, I had a bunch of shitty ones. And then eventually they sent me over to UT Southwestern. They have like the whole epilepsy center, epileptologists, things like that. And they have 4,000 patients for 4 doctors.
No.
When I first met my doctor in 2018, maybe, he was like, he looked like fresh off residency, so perky, like super sweet, had a little tie going. And now he has the beard, the bags. Like 5 years later, he is just gone. So I think for some reason, the deeper you get into the medical profession, it'll bring out the assholes out of people. Some doctors are just complete assholes. Like when I had my surgery, does anyone have an RNS? Do you guys know what that is? So I got my RNS in December, and when I came out of it, I was in like, that was the worst pain of my life, and I have been in a shit ton of pain. And they're like, I don't know, it's not supposed to be this painful. And I was expecting pain because it's brain surgery. And I'm like, there's something wrong. I'm in way too high of pain. What's going on? And I thought that they weren't hearing me. And I thought that they weren't listening. I thought at the time, I thought they just didn't believe me. And they weren't giving me any sort of pain meds, anything like that. And later I find out when I'm looking at something on my chart months later that I had swelling in my brain from the surgery, after the surgery, and that was the pain that I was feeling. And the reason they weren't giving me narcotics is because narcotics make the swelling worse, so they couldn't give me the meds. No one thought to tell me this. So
So
I
you were
thought,
under the impression that you were going to actually have something to help with the pain, and nobody told you that it's once the anesthesia wears off.
yeah, I was under the impression no one believed me. And it's those little things, because they're not spending the time to explain things to people. That's what makes them think, oh, well, my doctor fucking hates me, because they're not treating us like, hey, we're people, talk to me, They don't have the fucking time to do that anymore.
So this is the same practice that has that volume of patients to 4 providers. Or
I mean,
you said it was like 4,000 patients or something ridiculous.
it's like 4,000 patients, but there are 4 epileptologists, and then they have the mid-levels that monitor, and then but they're inpatient and outpatient. So 4,000 people outpatient. Most of them just have to get refills of meds, but the more complicated ones will go in the EMU, and then for all the mid-levels kind of just monitor, and then the ones that are like having serious difficulties, those are the ones that see the doctors. But that's because I'm with a research hospital. I tried like 6 or 7 different doctors, and they took one look at my EKG or EEG, and then they just like got scared and ran away.
What's up, Toaster?
What was that?
Oh, Toaster had her
Can
hand up. It sounded like she had something to add.
Yeah,
That's
actually, it's a question.
ridiculous.
I hope you don't find it as invasive. What research hospital?
It's UT Southwestern
UT
in Texas.
Southwestern. I hope this doesn't make me drop. Give me a moment. Texas?
Yeah, it's UT Southwestern. UTSW is what you want to search. They're like one of the bigger hospitals in Texas.
So overall, I mean, I know this is pretty new. Did they turn on your RNS? I know after a few months after my surgery, they didn't actually turn it
Holy
on
shit.
for a couple months.
Supposedly it's a level 4, but I don't believe that.
Yeah, it is.
Not after what I heard.
UT Southwest is great. They are a great hospital, but they are so, I mean,
Inundated
they're
with
the
people.
only, they don't, yeah, there's like one of the only ones in Texas that are level 4. So
Well, and I have to say that, so I'm in Seattle, and we're just getting
Wait, this looks
inundated.
familiar. I've looked this up before.
yeah, they're good.
And
Yeah, yeah, I think I've looked this up before.
well, I was going to ask, like, has that level of the ratio of patients to doctors, has that gotten worse in the past few years?
Not really, because most of their patients, they don't make appointments with. Like, most of their patients are the kind of epilepsy that doesn't really need to be monitored as closely. They probably have maybe 10% of them that they're actually closely seeing all the time. So they just have like that many people within their system, but they're all over the country.
Okay. Sorry, this is starting to make a little bit more sense.
Still, my
This is going to sound
my
weird.
doctor still looks like he just got out of prison, though. Just because he went from like really preppy looking adorable guy to just got married, sort of cute little guy, and now he looks like he just got out of prison.
Well, that's great that you can actually remember that, have that memory to compare it to.
Well, I've been working with them for a long time.
Okay.
Long time.
Oh,
I
okay.
mean,
So,
I
so
spent a
that
lot
helps. This
of
was
time in
before the
hospitals.
RNS process.
Oh yeah, because I've
Okay.
taken over 20 drugs, 20 different drugs. I have the VNS here as well. And to
Wow.
answer your question, is it Kate?
Kate or Katie?
Hi, Kate. Okay. So for the RNS, I got it done in December. And in December, I was probably having, at that time, maybe 2 or 3 tonic-clonics a month, but they would last up to like 5 minutes a piece. And then I got the surgery. And then I didn't have a fucking single seizure until last Friday.
And you're saying the RNS, you're crediting that to the RNS or more the VNS?
They haven't turned it on.
Right. Okay. So that's more the VNS actually doing its job.
Just the surgery, just getting it implanted. I hadn't had a seizure for like 8 months.
Wow.
And they haven't turned it on yet. And they're just about to turn it on because I just got that seizure, so they know how to do it.
Okay. Okay. So that RNS, once the
I was in
electrodes
the
are in there, that was
learning mode.
right.
It
Okay.
needed
Now
to
I remember.
record the seizure so that they know how to stimulate.
Oh
But
yeah, they love playing with those settings. Do you
So
have the
that'll be
RNS
fun.
tech and the doctor in the room when you go to your RNS appointments?
Yes.
Yeah.
And it's
That's a pretty
annoying
typical.
because for some, like, anytime I say something like, oh, well, yeah, it took a little, like, complain about the tablet or something, she sent me a brand new fucking tablet and it's still sitting there in, like, the back of my room, still unopened. Like, I'm not gonna open that. I'm probably just gonna bring it to the appointment and give it back to her.
Yeah, they get really strict about those data transfers. Are you guys familiar with how RNS works? I don't think I've ever explained this before in the after depending on no, actually I think it's with all the electrodes. Did they give you those depth electrodes, the rods that go in, or did they do the topical ones? Do you know what
They
kind of
did both.
electrodes you got? Oh, okay, you got
They
both.
did 2 depth on either side, and then they
Mhm.
did the little thing on top.
Right, the device right here. Okay, yeah.
Yeah.
So that's the same electrodes that I got. And what the YRNS is so strict about data transfers is that apparently these are supposed to be recording brain activity 24/7, but the stimulation only occurs when the activity shows seizures. So they have this magnet that they asked me, and I think of that as like a bookmark for the tech, because that'll just like make all the spikes go out of whack and it'll show them where I think I had a seizure. And that's the ones that they, from what I can tell, if they see that my version of a seizure corresponds with like a certain pulse, then they'll adjust the settings to either like make that stimulation longer or happen earlier or more powerful.
Oh.
There's a lot of things they can play with, but that's why they're really strict about us doing data transfers every day, so that maybe somebody has a chance of like studying this data before we show up for the appointment. Over time, that's proven less and less effective with me. They just don't
Yeah,
talk
I do
anymore.
it maybe
And
once a
yeah,
week. If I do it once a week, I feel proud of myself. So, but it's all right. You did say something. Can you move? You're like in my way, bro. Um, you said something pretty, cuz have you guys, any of you been diagnosed with the psychogenic seizures?
misdiagnosed is what we hear a lot.
Yes, exactly. And it's always when they're trying to figure out if you're getting auras or not.
And that's enough for them to give you some kind of starter med, say try this and we'll talk.
Well, because technically an aura is a seizure in itself, right?
Yes. Yes.
So they
Partial
say,
seizure.
okay, well, we got to figure out if you have auras. So they put you up in the EMU. They tell you to press the button if you feel weird. You press the button, or you tell the nurse, yeah, I might be a little nauseous. She presses the button. And then they're like, oh, yeah, well, you didn't have a seizure, but your button was pressed. So you have psychogenic seizures. That's what's making you feel weird. I'm like, well, I mean, you could have told me, like, hey, what am I supposed to be feeling? What is weird? You know, like what am I? It pissed me off. That's psychogenic, and now they are forcing me to see this psychiatrist that specializes in epilepsy, and he costs like $200 a month. And the only thing he does for me, he prescribes me Adderall. It's the only thing he does. This epilepsy yeah, that's the only thing he does.
So do
I'm
you
gonna
feel like this
bust.
psychiatrist is actually contributing anything to your care?
Adderall.
But that's what I mean. Do you actually use the Adderall, that because Adderall is a stimulant?
Oh yeah. I
So
use
that's
I use the Adderall.
kind of
I mean, I
risky.
do have to be careful because there are some times where I'm feeling like if I'm feeling strange, I'm not going to take it because they can cause the seizures, but they're not like they do help function in between for sure. I've just had to I mean, I'm sure all of you have gotten to really good at kind of reading your own body and what is feeling weird and, you know,
Versus aura.
like that because you
The
can't
thing
ask
is, with me,
anybody
I've never
else.
gotten auras.
I I one of the best doctors. I only had him for a short period of time. Um, because my husband ran him off and well, ran off his mouth, and shortly after we got a letter saying, yeah, no. But the first time I met him, he said, "You know your body best." Because I was going in there prepared to explain why I'm on Ambien and Seroquel
Yeah.
and all of these epilepsy medications because I wasn't in with Duke at that moment. And he said, You know your history. I don't." And it's like, oh my God, thank you.
That's generally not how most doctors think.
No,
And
no.
that's a rarity.
But before that, I have um both diagnosis, psychogenic or yeah, psychogenic non-epileptic seizures, PNES, and epileptic. Both. 30% of epileptics will have PNES, and vice versa. No, the vice versa is the autism. Never mind. But the
Yeah,
30% I am sure of because I remember
I
Dr.
think
Lundy
a
telling
lot of
me.
people have been misdiagnosed with that. Granted, I'm sure it's a real thing. I'm
Oh,
not
yes.
denying that it's a real thing, but I definitely think that they jump too quick to conclusions with that
Oh,
particular
that I
diagnosis.
agree with. Oh, definitely, I agree with. One of our friends was battling that forever. She recently just got her victory.
Um, I did want to ask, does anybody in the group have any children? You guys are all moms? Oh, biological?
Both.
Are you guys terrified of puberty?
Yes and no. I've gone through it with my older kids, so the youngest should follow the same way. That being said, oh great, you want me go? You- Never mind. I trauma dumped this on Katie yesterday. Don't want to go into it
You
again,
think I remember?
and that's why I did it.
We make good support because we don't remember what you said the next day.
That
And we
is
love
why
you
I
all the
take
same.
notes. Notes for everything.
Between that and my weed addiction, then yes, my brain is gone.
Um, so before Bill Cosby went weird, they had a joke about children and how all children are brain damaged. It fits children and their parents to a T, believe it or not. Or at least at the
I
us.
Did any of you had seizures while you were pregnant?
No.
My tonic-clonics got longer and more severe every trimester, along
How-
with like the major hormonal shifts of like when breastfeeding started and stopped, and
So
Well,
your
yes.
seizures are hormonally.
clearly catamenial.
Yeah.
Yes, since
Because
high
Yes,
school,
mine
never
are
had
too.
auras.
No.
That terrifies me. What happened?
The first pregnancy, the first thing you asked about puberty. Not completely terrified. Daughter's 14. I'm just trying to get her to open up and talk to me about birth control so she can know the reality of, what's actually out there before you're even active. Just know what you're going to be told. But regardless, she's been through puberty and nothing obvious. We all know the signs to watch out for focals and, obviously generalized. So she's well aware. She'll remind me pretty consistently how many times she saved my life, and she'll, check pupils and know what to do. But not terrified about puberty as much as, it used to be more pregnancies. After the ectopic pregnancy, wasn't aware that Depo wasn't going to work with the medication I was on, because they don't tell you that. And way worse cramps than usual. They went ahead and did the ultrasound and said, you just had a miscarriage, so we got to get you booked. Or not like I'm getting arrested, but we'll get you inpatient. Oh, I hope they edit that out.
That
That's what it felt like.
That's pretty much the reason I'm here right now, is because I've always wanted kids, and I'm getting married, and never thought I would be able to have children of my own. Just the thought of me being pregnant and having a seizure, and the risk to that, or the risk of giving a child and passing along the seizures, or the risk of me having a seizure in front of my child and traumatizing my child. And that just is in my head 24/7. And I'm just like, I don't know what to do with it. I mean, it's not something you can, there's no solution. There's no solution to it besides I either put up with it or don't have kids. And shit, my medication is like $200 a month. How would I even afford kids? Ugh. Anyway,
Well, I have to go, you guys. Sorry, but I just had to cut in and say I have to go.
Thank you for coming, Jocelyn. So
I'm
happy
coming
to
back
see
later,
you.
but I'll see you guys on Friday. Okay.
Absolutely.
Bye.
Bye-bye. I mean, as far as what everything Hannah said, I mean, it really sounds like you're doing it right as far as planning and contemplating every aspect possible, because the less you have to worry about, the better. And that's way more than seizures when you're pregnant.
Before I had kids, I didn't think about any of that stuff. I didn't worry about having a seizure when I was pregnant or delivery. After I got pregnant, I started worrying about that stuff. And so I went into it really just dumb about the whole situation. Because when I got epilepsy, I was just like, okay, whatever, blah, blah. And then I got pregnant. I was like, okay, this is going to be good. I'm a normal person. Because I wasn't having them that frequently. And then, and then as time goes by, you start to realize the realities of it. Like, I remember the first time that I had a seizure when I was home alone with my kid. And like, because I just have tonic-clonics, and I just remember like becoming aware, and he's like a 3-month-old sitting on the floor, and I was like, oh my God, did I have a seizure? And I was never really sure, but I mean, I had all the symptoms like being confused and like, and I was like, that's scary.
that's
It was really
terrifying.
scary.
I
But
just
I don't know, you just set up your safety parameters, you teach your kids from an early age, like how to take care of you, first aid and emergency, how to make phone calls and stuff like that. And I mean, if you have kids, that's all you can do. I mean,
I'm sure my husband would be just fine handling that. I'm just like Kate. So, Katie, when you had your seizure when you were pregnant, like it didn't hurt your daughter at all.
Right. So 3 pregnancies total, 2 full term, and each pregnancy had 5 tonic-clonics that lasted at least 5 minutes, and the usual 2 or 3 partials each trimester, or each month rather. And they've come to the conclusion that there were no, that that the son is 4. He was born in 21, and he's developing. He's really tall, first of all, but mentally,
Mine's little.
I gotta believe him when they say he's all the way there, but he's a boy. Good God. Um,
I know
yeah.
that.
Other than that, I mean, he's talking. He's talking enough, and he's definitely functioning at and as expected for a 4-year-old daughter. Surprisingly, during COVID, she was in 5th grade and switched to homeschool. We left the K-12 in Florida because it's the stereotypes are true, and now she's doing an online home education program out of a school in Washington State, taking advanced classes. She's in dual enrollment at this point, or not dual enrollment. She's on track for dual enrollment rather. Got a couple of high school credits last year, and she's starting her freshman year in a couple of weeks. So I
So
think it's safe to say that there wasn't anything. I was on carbatrol for the first pregnancy, the duration of it. The second
you were on
pregnancy,
what?
it was a carbatrol. It's an extended release
Okay.
capsule that I think they don't make. No, they do make a generic for that one.
Are yours generalized?
Both.
Me too.
And the second seizure, or the second pregnancy rather, was the ectopic. I was on clobazam and Ficomp. It was a little bit of a cocktail for that one. I know it was 2 80s and a benzo, and
Yeah.
that's what we figured out after the fact is what just killed the effectiveness of the birth control. And that was first trimester miscarriage, so I didn't know I was pregnant, but I again, looking back,
Yeah.
had worse seizures in the weeks leading up to that. I wrote it off as like around the time of the flu shot or something like that. That's the same year I stopped getting flu shots because vaccinations are another trigger for me. And
Wow.
yeah, third pregnancy, Keppra, the generic Keppra levetiracetam, the duration. And it was at a high dose initially when upon conception. I think I was taking the max dose of 6,000. RNS, however, was already just activated, or they had adjusted the settings at that point. And I'm not proud to say, but I took it upon myself to let RNS do its job. Essentially, I got off of the clobazam, titrated myself off the clobazam, and
Don't blame you with that clobazam. That shit is like, but that's like the only medication where if you stop that cold turkey, it can kill you.
so I kind of titrated myself off it. They give you those really small capsules to start with. So yeah, I would never recommend anybody else do it like that, but I just felt so unheard by any and every neurologist that I was seeing. And the Keppra now I'm taking half of a 250 milligram tab twice a day, where they have me prescribed to take 3 tablets twice a day.
Clobazam's as hardcore as you can get, pretty much. That's like taking Klonopin every 10 minutes all the time.
Yeah, but that's why I feel so much better off of it. I
Yeah.
have some energy back. I'm getting things done. My
I used to be on the
short term
clobazam.
is there.
That shit was, I couldn't do it. I could not do it. I had them take me off of it almost immediately.
That's what I did with Ficompa.
I can't do Klonopin. I have an adverse reaction. Instead of crashing me down, I get super, super, super high. And when I get high, I get hyper. And
Yeah, those medications are really concentrated. They're strong.
yeah, I was having hallucinations. I had my dad just took it twice, once in high school. My dad had to come pick me up, and once when
What did they use for your rescue?
I don't,
You don't have a rescue? What kind of
I
seizures
don't,
do you have?
Fogels and tonics.
And the
Um, uh,
tonics, do they last any longer than how long do they
they
last?
30 seconds to a minute,
Okay.
which they used to before my surgery last anywhere from 2 to 4 minutes.
Which surgery?
Oh, I got I'm in the question mark club.
Oh, the RNS?
Nope.
Oh, no, the that's a brain
Right
where they
temporal lobe
lobectomy?
resection. Yeah, lobectomy. Yeah, that's it. Um, and basically, I have a bubble in my brain. Actually, it's filled with liquid. It's a liquid bubble. Um, I forgot where I was going with this. It was no. There was something I really
We
wanted
started
to
off with the
tell you.
Klonopin, and then
Rescue
started talking about
medications.
yours. Yes, there you go.
we
That's wild. I can't even imagine not having my Klonopin because that's whenever I'm starting to because I don't officially they say I don't have auras. They say that it's the psychogenic, but anytime like I've kind of identified when I feel weird and sometimes I'll have a seizure after and sometimes I won't.
sometimes you won't.
And because I didn't, they're like, okay, well, it's not, or because I don't know. I don't know. I just know that I know my body and I know when I feel weird and I feel when I take my Klonopin when I'm feeling weird, then I feel better and I can go back to doing whatever I was doing. My last seizure I had on Friday was in the middle of a exam, the entrance exam for nursing school. They
Oh,
had it on video and I was taking it for the second time because I was trying to get a higher score. The first time I got an 89, I was trying to beat 90. So
89's still really good.
it was still really good, but another reason I was taking it is because my power cut out in the middle of the test the first time. And so I didn't think that they were going to take it because I was doing it online, like the proctoring online classes. And so when my power cut
Oh,
out, I logged back in and I
no.
kept taking the test and I didn't think that they were going to accept that because my power went out. So I took it again. And then after the seizure, when I called, like I finished the test, I had the seizure, finished the test like 3 hours later, and then called
Oh
in and said,
my.
I'm so sorry. I had a seizure. You can trust that I had a seizure because it's on the video that you can see. And the woman, like I was talking to, she was
I'm
like,
sorry.
what the fuck do I say to this? I'm so sorry. I'm gonna make sure they take that first test. We're gonna make sure you take that it's okay. You don't worry about a thing. We'll take care of it. I'm like, okay, cool, thanks. Any chance I can get my $250 back? No, but it is what it is.
Oh, that sounds like an unwelcome timing. But isn't that the timing? Like what's notorious about these?
It's the worst timing.
Yes, always. It's
Anybody
never a
have
good
a
time.
head-sized hole in their wall?
I'm not sorry for laughing at any of this. I like to laugh, and I rather see humor in stories than not. But oh,
That's where parenting comes in useful.
yes,
One pet,
exactly.
guys.
Like you see him doing something. It's like, oh wait, this is going to be hilarious.
Oh, that's
Yep,
another
yep. He
reason.
started eating it.
Okay.
What are you doing? The same child that will not eat anything on his dinner plate
Yeah, I should not still be
is
breastfeeding.
it's Oh no, I should
Yeah.
have seen it coming because the boy was so picky he wouldn't latch.
Oh, okay.
Yeah. So, sorry, I saw that from yeah. Um, the biggest kindness, or one of the biggest kindnesses I ever received, um, was I had Jeffy was newborn. I had just left my ex for the first time. I, what happens in Vegas stays in Vegas. This story leaves Vegas because it's a story of kindness.
So I work for the longest time I was trying to find where to work, that I would get like good leaves, I could work from home, things like that. And I ended up getting a job in prescription insurance. And I so I worked for Caremark, CVS Caremark, and work from home. And I've worked there for 6 years. They have awesome disability, pretty much approved anytime I can't work. It's just like, okay, don't just send a message, you'll be fine. And I can pretty much choose my schedule. But the real good, I mean, they're basic pay, but they have saved me so much money in me bullshitting and like working around my insurance. That phone call I just got, I told my insurance, because my insurance is about to switch in a month. I told them that I lost 3 months worth of my seizure medications and that I was like needing to get 3 months of my seizure medications, even though I just picked up 3 months. So I'm building a stock for and using my job to get free medication.
Hey, if it's not a Schedule 4, if it's not one of those controlled substances, then you could do that.
It is a controlled
You
substance, but
gotta survive.
when most people call in and they'll be like, okay, well, we can see if it is good for an override. They will say, no, we can't do it. It's a controlled substance. But because the regular people, they don't know, but you have to ask for a senior representative because they have the ability to make exceptions and manually place in those overrides. And so they can put in the override, they have the authority to do it, but the regular team doesn't do it. So they don't, so they tell you, sorry, your plan doesn't cover it, you go to the ER. But if you ask for a senior member, they can place that override for most plans. If most plans they'll make an exception for a controlled substance if it's life-threatening. You need the
Hey, at
doctor to
least you know
sign
who to
off
talk
on
to.
it, and you need the pharmacist to sign off on it. Most pharmacists don't have a problem giving out seizure meds. They'll be suspicious if you're trying to get a controlled substance loss medication override for oxycodone, but for Xcopri, they're going to be like, okay.
Right.
So you just got to kind of check off the boxes. I've been learning how to manipulate my insurance to build up because I mean, if anything happens, money is not going to be very helpful. I need to build up a stock of meds.
Yeah, that makes
Yes,
sense.
that was my Las Vegas story.
You have to survive.
Yes.
That's a pirate.
I just felt so
That's the
satisfied because
pirate
I
spirit.
just got the call from CVS saying, yep,
Just
it's $20 for 90 days worth of medication and we're gonna give you it. And I'm like, awesome. I just wanted to tell. I was just very satisfied.
Did you guys get any of your energy back, per se, after, you were done with the breastfeeding and the pregnancy and all that?
I went into clinical depression.
Oh, or that. Okay.
Yeah, well, I had just been diagnosed with epilepsy. Just have a newborn who's not
Oh,
latching at all, and he requires the most expensive formula
Formula.
on the market because he has eczema that
requires something.
my poor dragon boy has scales.
Oh, okay. But
Um,
that's adorable that you found a way to make, let him know that that's nothing to be embarrassed about.
exactly.
Give him that nickname and raise him with it. That's perfect.
He is my dragon boy.
They
And I call him my dragon. Pookie's mom calls him Sunshine. Mine is Dragon. Um,
beautiful.
How did you
and
guys handle explaining epilepsy to your kids?
oh, very, very easily. Sometimes my brain and the kids are smarter than you think. They are. Oh, and brains spark. That's how a thought. That's what a thought is. It's a spark. You look at something
A
and you
really
think,
great way to put it.
I wonder what's
Oh,
on the
she's the
other side
author.
of the door.
You can tell. You can tell. Words is Toaster's strong suit for sure.
She's very
Yeah,
eloquent.
thank you.
Exactly.
Um, it the sparks in my brain sometimes will just spark way too quickly, and then it will spark another area, which will then spark way too quickly, and they're sending all these messages to your body. When you raise your hand, that's your brain saying, hand, go up. Mine is saying, hand, freeze, and jerk at the same time.
Does it scare your kid? Because I know, Katie, you said that your kids have
Daughter.
seen you have, yeah, your daughter have seen you have seizures
I thought it would,
a
but it doesn't.
bunch, but it doesn't scare them.
No, they're resilient. They are surprisingly resilient. And just being around me, I've had him stand up, and you have to have the hands in front of a crowd saying, "It's okay. My mom has epilepsy. It's all right." And
So
it's like you can't rely on your children, but a knowledgeable kid is reliable.
that makes me feel so much better.
One time
Um,
I was at the coffee shop with my kids and I had a seizure and my son, he's older than my daughter. I don't know at the time, he's probably 8 or 9 and not that old. Um, but I had a seizure and he was like telling everybody, it's okay, she has epilepsy. It's not a big deal. And my daughter was crying because she's younger and he was taking care of her. And then when I came to and like we were back at home and talking about it, all he was just so happy because they just gave him all this candy and they were so nice to him. And it was just like a highlight. And he was like, I want to go back there. Like in my mind, I'm like, I'm never going back there. I don't want to see those people.
Now, Clark Kent.
That's incredible though that you got to see some positive in that. That's brilliant. See, I've
I
always felt a little guilty about Talia having to mature so quickly.
Yes.
And I think she does use that to her benefit at this point.
Mine
But
tries to bargain.
absolutely, TT knows when to bargain. But I appreciate how she explains it to little bro.
Yes.
She says this is just mommy doing her dance, and
Oh, yeah.
if she can't
I
dance,
that is actually very true. I'm gonna admit, if I didn't have my daughter, Jeffrey probably wouldn't have turned out as well as he has.
and mine have a 10-year age gap.
Because, yeah, I mean, she was hitting puberty when he was born. It's let's see, I'm trying to think of, she is turning 25 this year.
That's exciting. That's a
And
milestone.
Yeah, and Jeffrey's 9.
There you go. That's a hell of an age gap.
Yes. So she was definitely there to help, and just by her not panicking.
Yeah. Example. Lead by
Yep.
example for sure.
And of course, Jeffrey absolutely thinks thinks that his oldest brother is a walking god because Maddie lets me play on his Switch. It's like, you have a Switch here, and yeah, but I get to play with him. It's like, okay, I see what's going on.
There you go. Learn what to love.
Yep.
So this is a relevant chapter with all the stories that we read, or a relevant question rather, being that we read stories a lot.
Oh,
If
yes, we do.
your life was a book, what chapter would you reread? This discussion kind of made me think that mine would be, I feel really guilty saying my second pregnancy, but that's the one that I can remember better at this point, and I think I would rather relive.
What was the question?
If your life was a book, what chapter would you reread, Melissa?
Would I reread?
Yes, in other words,
Oh,
relive essentially.
oh, okay. I thought you said what chapter are you in right now?
Oh,
Um, and I was like, oh, I definitely reverse puberty. That would be my chapter right now. It's a horrible chapter.
so that would
And
be a rewrite for sure.
if we could
Right.
just
Yes.
rewrite, if we could just skip this chapter, I'd be so happy.
Oh yeah.
Um, I don't know. Maybe my whole childhood, because I don't remember anything. So that might be
That's
nice
true.
to remember what happened.
Absolutely. And I hate how I have to learn about my childhood from everybody else's perspective because I don't think it's accurate.
No, my sister does the same thing, and she loves, and she's big on like, um, I don't want to say dark humor, but she'll kind of pick fun at my seizure sometime, and she'll just to anyone who'll listen, she'll be like, "Oh yeah, I
I
had a
love dark
whole
humor.
book of things Hannah would say after she was coming out of a seizure." My favorite was, "I'm a man with a big appetite," and then she'll just go down and list all the things that I said during a seizure and like I don't know. She loves to make fun of that.
Actually, this sounds like
Okay.
a hilarious idea.
Oh yeah,
Now, only if the person you were writing about is consenting. That is the main thing,
Willing,
because it
yeah.
doesn't
No, I asked her
become
to
fun
write them
otherwise.
down. I asked her because
Okay.
she would tell me after, and then I'd keep forgetting. So she started to journal all the things that I would say. One time I came out of a seizure and I kept singing. I think I sang the Hokey Pokey for 20 minutes straight and didn't remember it. And I was doing the whole thing and just kind of like just laying there doing the Hokey Pokey. There was one time where I had a seizure just like last year, and I um got up like 30 seconds after I got up, said, "I need to go to the bathroom." And I wasn't at my house. I was at my friend's house, and my friend was like, "No, no, 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 no." And I'm like, "Shut up, bitch. I'm going to the bathroom." And I went to the bathroom, came back down, laid, and I woke up half an hour later and my husband was there, and I'm like, "What the fuck are you doing here? We were just watching The Bachelor. You're not this is the girls' time. What are you doing here?" He's like, "You had a seizure." I'm like, What?" But yeah, I mean, I've done all sorts of things coming out of a seizure.
That's impressive though that you get so many motor functions back so quickly. I
I
don't think
didn't
I would be
until
able
the
to do
vagus
something like
nerve. I
that.
just don't I would say things coming out of a seizure like when I'm post-dictal, once
Mhm.
I'm kind of just coming out of it when I'm not really fully aware, but yeah. Now
And this
I
is
will say
unprompted. This is
and
not somebody
do
asking you
things.
questions.
Yeah, most of the time it's just me being really confused.
Okay,
Confused.
that makes sense. So when they got your VNS, what prompted the RNS?
Hmm.
I don't think I've ever met anybody with more than one implant.
The VNS brought the seizure severity down, um, to where it wasn't, because for a long time, they weren't trying to stop the seizures, they were just trying to keep me out of,
ICU.
status.
Oh, right, right.
So, for a long time, they were just doing that. I mean, they had me drugged every which way. I had tried 20 different drugs before I tried the VNS, and even when I got the VNS, I was on 3, and, the the drugs that I was on, they fucked up my kidneys so bad I got a kidney infection, and, um, all of the drugs and everything, eventually, over time, I ended up, getting, like, kind of fibromyalgia pains and pelvic pains and just weird random symptoms that nobody could explain, sort of thing, and so they needed, and it still wasn't really controlling my seizures, so they just needed something else because the meds weren't working.
So drug resistant is probably something that's on your chart too.
Absolutely, yes. Not that I'm
Okay,
not on
that's
them, but still.
but that was my shoe in for RNS too, and I went to one of those
Yeah.
teaching hospitals, so it sounds like it was a pretty similar path. All
Yeah, at
right,
first they said they were gonna do, the DBS, but they changed to the RNS.
DBS is the one that's deeper, is it?
It's just pretty much the same thing, it just doesn't record and it's constantly going off.
Oh, okay, that was the biggest
It's
difference. It's
just
not
a
responsive.
constant instead of responding.
Got it. Well, I mean, do you feel like either one or both is actually doing their job? It sounds
Yeah,
like you said the severity did already go down, but it's
they've
the
saved my
frequency.
life, for sure.
Okay.
The devices have helped, just the VNS has helped 100 times more than any medication has. So, I am all for the devices.
There we go. Beautiful endorsement.
So, if I ever get bankrupt, it's not like they can take it out of my head.
All right, good to know. That part's still going to be in the recording, I'm sure. All right, so another question here that might be relevant to us. It's a post. Somebody says dating is a joke. A 40-year-old female. I've had epilepsy for about 30 years. Never have I been able to have a relationship, a real relationship. Being well medicated comes with a lot of restrictions. In my younger years, I was on Keppra, and I used to have a couple of alcoholic drinks and stay up late and go to parties. I got hit on by guys, which was a surprise to me because Keppra made me extremely short-tempered. While I was a serial dater, my female friends were getting engaged, and I was too afraid to commit to someone because having a seizure isn't pretty. Fast forward to now, I'm on Briviact, which is a big change in how quickly I can get angry. Sound great? Not so much. Now I feel my emotions more. I get sad, cry, isolate myself because now I also wear hearing aids. I'm too afraid to be social and drink anything alcoholic, not that I ever really like it, but now I feel forever single. All right, so before we get into the comments, what's your perspective on that? You had the diagnosis. Did everybody here have their diagnosis before they started a love life? Okay. So Melissa, go ahead. What do you think? What's your perspective on this?
Um, I got diagnosed like a couple years before I got married, but I met my husband like right after I got diagnosed. And we dated for a long time. And I think after we got married, he says, I'm like, I didn't know if I wanted the responsibility of marrying somebody with epilepsy. And but we're already married, so he got unlucky. It was too bad for him already. So but I can imagine it being difficult to like find a partner when you're just trying to take care of yourself and your own health. And I know people that are in good health that have a hard time dating in their 40s anyways. The older you get, the harder it is. And I mean, I know a lot of people that are in their 40s that are or older that are single and they're happy. You can make a fulfilling life. It may not be what you expected
Or
or
what you planned.
desire. Yeah,
Yeah,
but you can still like have a full and complete life. And
absolutely.
I mean, and you know, it doesn't necessarily isn't just because of epilepsy. That's my
Yeah,
thought.
there's more to it than that, that's for sure. Like your epilepsy isn't you. It's a part of you, but it
Yeah.
doesn't define you. Yeah, that's a good one to remember. Hey Raven, if you're there, I forgot to ask you the icebreaker. Are you with us? Okay, we'll get back to you.
Yeah,
Yep.
I'm
Okay.
here. I couldn't get
Beautiful.
my computer to respond.
Okay, no problem, no problem. It happens. So the icebreaker today was the question of how did you feel about yourself as a woman after your diagnosis? You started having seizures. Did that change your perspective at all?
Oh, no, but I mean, I'm already like genderqueer anyway, so no, not really. No effect on my how I view myself as a person in
Beautiful.
that regard.
Yeah, that's perfect. Sometimes that is pretty hard to deal with for I think it's most of the ones that get diagnosed during puberty when you're already kind of unsure about yourself and getting comfortable in your own skin and now yeah, you have to watch out for a whole nother thing.
Yeah,
And when it was associated with the time of the month for me and all that, then I was thinking if they put me on these hormones and I just go backwards, then am I going to be like, some little flat chested, like 10-year-old for the rest of my life? What are you actually going to do to me? And
oh
that
my
was another
gosh.
thing that did not help about the doctors never explaining something. They were so quick
Yeah,
to write a prescription, say, do this because I said so, and, don't drive anymore. That was
that's
as much as I got.
Pretty much having to do all your own research as a kid that doesn't understand the world anyway.
Exactly. And I'm
And then
thinking,
you're
okay, if they're going to take my license, I better get all the miles that I can right now. And that didn't turn out well.
oh
when I was younger, I felt almost guilty for having the seizures because I could see the stress that I was putting on the family, but because I wasn't conscious during them, like sure I had the injuries or whatever after, but it wasn't like it's they look worse than they are, sort of things. Like you don't really feel it happening until after. And so it's kind of like something that's happening to me, but I'm not part of, if that kind of makes sense. So I felt like it wasn't it was hard
Not
to
by choice.
yeah, but it was kind of hard to process for me as a kid because I wasn't experiencing it as if you know what I mean, but everybody else like I had a seizure at homecoming and then I was going to school normally and everybody was looking at me weird and things like that. Like it felt weird to process that.
Yeah, that makes sense. I mean, we say all the time, we're not there when it's happening. It's the last thing that anybody could ever expect to think is that it's your choice in any sense.
So
And
what I
you're not there when it's happening.
so as far as like the dating and epilepsy, I didn't feel like epilepsy had anything to do with my dating life. It only brought into the date it only became a part of my dating life whenever I would have a seizure in front of somebody that I was with, and it was pretty much I'm like, all right, up to you.
And you
Stay in
had
or
your auras. Did you ever have the time to give some kind of warning?
no.
Okay.
My auras aren't really like they're not actual auras. They're just like, okay, well, I'm feeling a little off right now, so I'll lay down, but they're not actually like a warning. It's sometimes I'll have them, sometimes I won't.
Okay, that makes sense. Well, that's what got me thinking too. One of the comments here. This one is saying I'm 29-year-old male. My epilepsy isn't very well controlled. I finally quit drinking because I was in denial that alcohol made it easier to socialize. Now I drink non-alcoholic beers at bars with my friends. Found this organization called Phoenix that puts together sober activities like rock climbing and kayaking for free. I try to exercise and quit giving a fuck about my epilepsy. Like, sure, I could drown kayaking, but everyone has a time, and I'd rather die doing something cool. Reading the response from the male made me think it's just not that easy for a woman. It's just not with the stigma, and there's social expectations out there that if the woman has a seizure on a date without telling the guy, I feel like a lot more people would be on his side for being somewhat offended. But if it was the other way around, chances are there would be less on the woman's side if she was offended of like, why wouldn't you tell me or give me a warning of something like this? I guess that they would kind of have to break at the beginning if he asked her to drive, just saying I don't have my license.
I mean, I never really gave a fuck. I tried my best not to give a fuck about my epilepsy and to really not try to hide it, and because I figured it's nothing to be ashamed of. It's nothing I can change. I mean, but it's their decision if they want to be a part of my life. If they want to get to know me, that's up to them. I'm not going to hide myself from them. So most of the people when I was dating, I would tell them I was epileptic, but most of the time they just blew it off, didn't really think about it until they saw a seizure. And a couple of the guys that saw me have a seizure were like, "Oh yeah, I'm sorry, but that was just a little much." And I wasn't really offended. I just knew, all right, you're not the guy for me then, obviously. So, yeah, I didn't really think about it all too much in the dating aspect because I was pretty much just like, all right, balls in your court. Here's what I got. That's up to you. And I don't think anyone should be offended because I mean, people got to choose what's best for them anyway. If that's not, I mean, if you're looking to be in a relationship, you got to do what's best for both people.
That makes sense. So maybe my experience was more because my children's father is older. He's considerably older, and I think I was probably just fed that stigma of, just be silent and obey and whatnot and keep your seizures under control or else it's your fault. Melissa, from your generation, when you were in the dating game, were there any stigmas then about your condition slowing it down or impeding you at all?
Well, when I didn't have epilepsy till I was 27, so a lot of my dating times at the beginning were it just didn't have to worry about it at all. And actually, my husband is I think he's the first guy, maybe the second guy I dated after I got diagnosed. So I didn't have a long dating history while I knew I had epilepsy. Yeah, I think he was the first guy after official diagnosis that I dated.
Sounds like it
I
was
don't know,
meant
I
to be.
just got lucky, I guess.
Yeah.
But
And granted, I met my husband when I was 18 years old. So, I mean, I was a little slut before then. I was acting out because I was just I don't know. I was a confused little teenager, so I was acting out and I was a little slut, and that was my dating life until I went to college and I met my husband.
There you go.
I don't know if
That's
it's
one way to put it. What do you think, Raven?
I don't know if it's like a generational thing, so much as like just maybe a jerk thing, honestly, because my ex-husband would never have taken this seriously. He couldn't take any of my other chronic illnesses seriously. And he's my age. I'm almost 40. But my partner now is 15 years older than I am, and he's super supportive.
That's awesome.
So I don't know, but dating with all of the things is super hard. I would never be able to date someone now if I hadn't already met him 5 years ago.
Yeah, that's kind of where my mindset is at this point too. Not even I just don't feel the dating game right now. This divorce is close enough to over, but I'm not looking to get back in the game.
It's hard.
I
It's hard out
mean,
there.
intimidating is a way to put it. You know, with
Yeah.
the family and everything else, talk to you like a friend, treat you like a friend, and if it comes to that point, am I actually going to be the slut for letting you know I'm not looking for a commitment? That's still, that's
I'm
still
wrong
how
with
it
that
is.
either.
Just be empowered.
You know. So when you were saying genderqueer, were you with any women long term that kind of you had to break it to them?
Well, I was only diagnosed with epilepsy like 2 months ago.
Hmm.
Oh
Um,
wow.
but
That's
yeah,
incredible.
my I have some other neurological chronic illnesses, and yeah, I was in a relationship with a woman for about 3 years, and she was kind of a mix between like really supportive and understanding, and also like really, really frustrated that I wasn't like taking myself more seriously and being more careful with not overexerting myself and avoiding triggers and that kind of thing. So she was probably more serious about it than I was, but um, I was maybe not the most mature person at that time.
And do you think that do you credit any of that with the medication changes? Or were you pretty much on a consistent medication since your diagnosis, since it was so recent?
No, I do. You mean my ability to
Well,
take it
if you
seriously?
had, yeah, I mean, just any perspective on relationships in general, because what comes to mind with me is the clobazam. That's the most recent medication that I weaned myself off of, where I actually took the notes. And I would never have made note of, increased libido, but, on my, in my 20s. But now that's relevant to me. I understand that that is actually, showing changes in the body on hormones related. And since I'm pretty sensitive to catamenial stuff, I think it's relevant to take notes on. So since you had or mental conditions before the epilepsy diagnosis, I was wondering if other kinds of medications actually had an effect on your perspective for different aspects of your life too.
Um, yeah, kind of. I was on so many, like, I have cyclic vomiting syndrome, which is
Okay.
neurological. I think maybe Lufa, was it Lufa? Somebody else has it in the group.
Mm-hmm.
And yeah, so when we were first trying to figure out what was wrong with me and how to treat that, I was on so
Maybe it
many
was Sia.
different
Yeah, no, I think
prescriptions.
you're right.
Yeah, the number of prescriptions that I was on were excessive. I mean, it was like I looked like I had 80 years, not 25 years to my life, when you look at my prescription. So the number, just like the sheer number of things going on in my brain made it really, really hard to think clearly. And I was just in general a really shitty partner because I couldn't keep track of things that I had talked to my partner about, um, like important stuff. And it made me look like just a really, really bad person. It made me kind of behave like a bad person. And I'm not a bad person. Once I got off all of those other drugs and managed some of my underlying I kind of came out of this fog and I was like, oh my God, like I was really awful. So I'm in a much healthier mindset. So I think that is contributing to my being able to be in a healthier relationship.
So that's helpful. Then you know what actually helped.
Yeah,
That sounds
too
like it
many
definitely
drugs
made a
at the same
difference.
time. And yeah, prescriptions. I mean, yes.
One thing to be aware of, though, when Hannah brought up the possible pregnancies, is that in an article that was recently released, I took note that high blood pressure in pregnancy, that I know that's a pretty common condition. They always test for. They'll monitor you for pretty closely through on your prenatals. But if you do get that high blood pressure in pregnancy, that's linked to an increased risk of seizure in children. And now I think that's something that's been suspected probably in the medical field for a while, but now there's enough studies to prove it. So at this point, I think if anybody has a pregnancy while being diagnosed with epilepsy, it's just more reinforcement that, like, the more you plan ahead, the better. So when or if something does come up unexpected, then you have all the focus necessary to dedicate to that and finding the best solution for you.
Yeah.
I did want to mention, Raven, because I heard that you said that you were acting different on medications. Because that happened to me. I got arrested, I punched holes in walls, I had like pretty much gone, like they had to give me psychiatric medications to calm me down after I had a reaction to, because I tried 20 different medications and I had reactions to all of them.
Oh my God.
And so there are periods of time, all of my memory is really foggy, but people will tell me that there were periods of time where like I had been tied down, that they would, like, my mom would just feed me benzos, things like that, trying to calm me down. And I always felt bad about it, but it wasn't me. It was medications fucking with my brain, making me crazy.
Yeah,
That's awful. I'm so sorry. And thank
that
you
sounds
for
I
traumatic.
just wanted you to know that you aren't crazy.
Thank you. Yeah,
You
I
should feel
felt
good
crazy.
about that.
And I was with an abusive partner at the time who was doing everything he possibly could to convince me that I was crazy. And I think I still feel like, I'm still responsible for my actions, even if I wasn't acting like myself.
But Raven, if you were taking care of someone, if your sister, someone had if they were on psychiatric medications that were adjusting what their brain, if they were not aware and oriented, you're not going to expect someone with schizophrenia to be completely aware and responsible for their actions. So why would you?
Well, I
If these
was
meds are
aware
messing with
and
your head,
oriented. I was just making really bad choices.
that happens too. We all do that. Everyone does that. It just makes it a little more complicated when your brain goes a little cuckoo sometimes.
I
Well, and
really,
it's even worse when you have that pesky partner reinforcing that it's all your fault, and you
Yeah.
kind of can't shake that mentality for years to come.
yeah, it's been about a decade. You'd think I'd get over it, but
I think we're on the same page on this one.
yeah. Thank you. I really appreciate your compassion about it. Thank you.
That's something that we truly understand. So there's never any shame in speaking exactly how you feel, because I know exactly how you get to that point. And still supposed to be raising children together, and I have to remind myself never to be proud of him for like holding a job for more than 6 months oh, I feel like such an idiot. But sometimes you just can't shake that mentality of like, take care of them. You're supposed to like
Yeah,
be what you're supposed to be, and that's annoying.
it is. It's oppressive.
Yeah.
It just gets really hard because we are trying to function in a world where everyone else's brains are different, and our brains are different. We're trying to function in normal brain world, and it just makes it a lot different because nobody that doesn't have seizures will understand. You can see a seizure, but even if you see it, you don't fully understand what it's like to have your brain work that way. And there's that disconnect. But I don't, you can't, it's just, you can't let that make you feel like you're not worthy or that it's your fault for being different. Because we're living in a world that doesn't really function like we do.
Yeah, that makes sense. Everybody is still their own, and we just have like one more layer on top of that.
Yeah.
Yeah, that makes sense. That's a good way to look at it.
Yeah, it is.
Were any of you informed about contraception interactions and hormonal adjustments recommended by the neuro, or was that always an OB conversation?
Mm.
I was recommended to OB, and then I went to OB and talked to OB, and they told me to talk to my neuro. So I pretty much just looked it up and told them I want an implant. So they didn't really fuck around at all with my hormones. I think everyone was too scared to touch it. They wanted the epileptologist to do everything in regards to the seizures.
Wow. So maybe that was a better course of action to just kind of get to the source. It sounds like
Yeah.
sooner than trying to adjust everything around it.
That's kind of been, well, when I first was diagnosed with epilepsy, I was doing all the 20 different meds, and each med would give me something different, like different symptoms, so we never knew what was causing what, and I was always on more than 2 or 3 meds at a time. So I was having all sorts of symptoms. They were changing my meds pretty much on a monthly basis, and they could never figure out what was causing what symptoms. And then I kind of fell into Zonegran, and um Zonegran was the main one. There's a couple others. I think Zonegran and Briviact and the CBD. I did that for a couple years, and I was still having symptoms, not psychiatric symptoms, but chronic pain, the fatigue, headaches, things like that. And they would do all the tests, racked up about 6 figures worth of medical debt before I finally just accepted, all of these tests are not going to tell them anything they don't already know. They just are not going to be able to figure out what is causing what with what they're doing. So I started to take it into my own hands, started to research different medications, look at medical journals, things like that, and got really kind of focused on taking care of myself, because the doctors, I can trust them to prescribe me the medication that works right now, but they're not going to really dig in and try to look at all these other symptoms that I have. I mean, I have all sorts of bullshit diagnosis, fibromyalgia, stuff like that, but they don't really know. They're pretty much just trying to say, look, your brain doesn't work right, you're having pain, but you're not, your body's fine. So get used to it. I've
So the medications that they're trying for these other conditions that are not officially diagnosed are really just seeing what happens.
well,
That's
yeah,
the
but they
vibe that I got when I was on so many when I was on more than 3 medications. I got the impression that that prescriptions were just being written offhand and see if it helps.
well, that's what they did. The seizure meds, that's all they did is try this one, see what works, and we did that for years. And then we landed on that combo, and that combo worked but gave me horrible side effects, and we didn't know which one was causing what. And I stopped medication on my own just to see if I could figure out what was causing what, and I was still having the fatigue and the pain and everything. But pretty much I just got focused on, instead of letting my doctors figure out all this, why don't I? And that's when I started taking all the notes, trying to do my own trials, things like that on myself, and figuring out what's going to work for me, based on just doing what I can for myself. Because those medications, the ones that did work and they gave me the side effects, they fucked up my kidneys so bad that I landed in the hospital with pyelonephritis for a week. And that was like a month before my surgery for my skull.
Oh, wow.
Jeez.
Yeah.
Okay. Okay, so another one here. I mean, I'm getting the correlation that some people it's really hit or miss. Sometimes your neurologist and OB, like the team required for women, another pretty consistent theme that I see is that women with epilepsy have to have more of a team, doctors who do communicate to make sure everybody's on the same page. And I never got that vibe. For mine, it was pretty much the neurologist handling everything across the board. Did you guys ever have any other specialists that seemed more informed, basically, or willing to work with other doctors?
When I first got diagnosed, I feel like my doctors were better when the less complicated my seizures were. They were awesome. Like my neurologist, they handled everything, didn't have to worry about a thing. But as it got more complicated, they kind of backed away and said, sorry, this is above my pay grade, you need to see a specialist. I'm sorry, I didn't mean to
that
cut you
probably
off,
helps.
Raven.
Oh no, you're fine. I don't even remember what I was gonna say.
We were asking something about whether the specialist that you have on your team ever actually.
Oh yeah.
Yeah, there you go.
Yeah. I see a specialist long distance in California, and they're really willing to work with everybody else. So
Yeah, that definitely sounds useful.
yeah.
Has anybody ever thought of epilepsy as having an upside?
Oh yeah,
Oh
Awesome.
really?
absolutely.
Elaborate on that, please.
Hell yeah. There's no better excuse to getting out of something or to making someone like feel like shit, or try to help you, want to get to help you, then, oh sorry, I didn't mean to miss that appointment, or I'm sorry, I had a seizure. Everyone just like, okay, I'm gonna help you. But not that I use that excuse. Most of the time it's not an excuse, but for school, just the diagnosis got me I double time on exams and tests, which was great, because when I wasn't having seizures, I would have all this extra time and I could use to study. And I mean, granted, it was necessary considering I had a seizure during my test on Friday, but I mean, just things like that. It helped me get it made it a little bit easier to get help from society, if that makes
Yeah, taking
sense.
advantage of any allowances that are out there. You might as well.
Exactly.
Yeah.
Totally.
And Raven, Uber, if you don't know, Uber it's either Uber or Lyft has a program, and your doctor can help you sign up for it. That they'll give you 2 free rides a month for any epileptics.
Oh wow.
Oh, that's not a state thing. That's like a national or a federal
No,
thing.
that's Lyft. Yeah, that's Lyft. It's either
Oh,
Lyft or
okay.
Uber. But they have a program within the company that if the doctor sends the information, and they say that those 2 rides are to get to and from doctor's visits if you need help with that, but they can be used for anything.
Wow. That's awesome. Thank you.
it's things like that that it kind of, it's nice to take advantage of, you know. It doesn't make it all better, but at least it helps us function.
Yeah, so
Absolutely.
that upside question came from this article here because I was surprised to hear about these things. That reframing epilepsy in terms of understanding, this is just a summary points here. Reframing epilepsy in terms of understand what is adaptive about seizures could lead to new research and therapies. So, I mean, it sounds like in the most part, a lot of what these therapies are concluding is that everybody's epilepsy is so individual.
It is.
That it really, there is never going to be some kind of cure-all, you have a seizure, this is what you do kind of solution. So I
Yeah,
do
no.
appreciate that, those points are being made. Also, they're noticing immune changes linked to epilepsy might offer protection against some infections like COVID. So did you guys have any kind of individual experiences with COVID or reactions different than others?
I never got COVID.
Same.
Oh, okay. Oh, Melissa, you didn't get COVID either?
No, I was so nervous though to leave the house because I was like, I don't want to even test it. Then nobody's talking about people with epilepsy and what their risk is with COVID. But like, I just was like, I'm not testing it. I'm not leaving the house. I'm not visiting anybody. I'm gonna groceries delivered. All that. I didn't leave the house for a long time.
Same.
Oh yeah, that was a long couple of years. I don't think I took notes of any more seizures during that time. I mean, I think the one time, the one or 2 days that it was like a fever, that I might have had a longer absence or a cluster. Yeah, I think it was one cluster, and that was the only thing. But can't help but blame that on the hormones too. I know your body, the hormones go crazy whenever you have a seizure or any kind of immune response.
My mom, she just like a couple months ago, she decided that she wanted to work as an EEG tech because of me. So
Oh,
she's working at the hospital that like everybody knows me at, like I'm in and out of. And so every time she goes in there, she's always telling people, oh yeah, she's talking about me and to other patients and stuff like that. And I'm like, Mom, if my doctor is working, you can't just sit there and talk about me.
right, HIPAA much?
Oh gosh.
Yeah, no,
Yeah,
I'm
but
proud of you for hearing about this nursing journey.
I'm just very glad that you reminded me to do this, actually.
Yeah, you kind of reminded me that I should have brought that. I'm not home right now, and I figured, what's a couple days here? But of course, with during the summer, there's no rush to go back home at this point. So I probably should have brought mine too.
I do mine about once a week.
There you go. Yeah, that's just another one of the setting, one of the reminders set along with medications on the list. That's the only way it gets done.
But I figure, like they're still going to get the information. I get that they're not going to have time to go over all of it, but every time I have like an actual seizure, like I send them a message anyway and tell them exactly what time, so they'll see it.
Absolutely. I was surprised to hear about this too. Seizures may trigger natural pain relieving chemicals that improve mood temporarily. Has anybody ever been in a good mood after a seizure?
No way.
I had a hard time believing this one. I mean, it's Wiley Library. It's a legit study, but
Told you about this. You put your right arm in, you put your right arm out,
that there you go.
yeah. You do the hokey pokey and you turn yourself about.
Perfect.
After
That's
a
the
seizure.
antidote we were looking for.
But Raven, I just want to mention, I spent years after I was diagnosed because I also had a whole bunch of chronic issues that they couldn't really put a finger on. I spent years chasing them down. Just I really, really hope that you're your best advocate, but you got to do some research because I have like 6 figures of medical debt trying to chase down each symptom and figuring I wanted to be like normal. And no one was ever able to get me to be like normal. I had to create my own normal. So if there's any advice that I can give to you, create your own normal, or else you'll be in 6 figures of medical debt. And now they're putting medical debt to hit your credit again. So
Fantastic. Wow. Well, thank you. Yeah, I've had a chronic illness since I was like 16, 18, somewhere in there. And so that's been a little over 20 years. And I've been bedridden for, I think, 3 or 4 years now. It's just kind of like you said, you have to decide, like, okay, this is what life is going to look like, and that has to be okay. Because otherwise you're going to go bankrupt and you're going to go crazy.
It's a hard line to draw between being your own advocate and creating that normal, because you got to know, like, all of these tests and all the tests that they have done, and there's no point to do those tests again, but at the same time you still need to have them, like, you need to know what they can do and what they can't, and if what they can do is not really going to be helpful, if they've already done it and it hadn't done anything, then there's no point in getting it done. It's a hard balance.
Yeah. You have to make choices.
So Hannah, you seem like a well-informed woman. I wouldn't be surprised if you got into this argument too. Did you ever ask RNS for your data? Being able to review your own data. How far did you get with that?
They said that I would need to fill out a form, as well as talk to my doctor about it, because the doctor has most of the data. I haven't followed up on it because my appointment is coming up and I was going to talk to him then. Especially because my mom, she's studying EEG now, and she wants to see mine now that that's what she took the class to do, is to be able to study my EEG. So we definitely want to get that for her. They haven't said that I can't get the data, but they definitely have put up a lot of hoops.
Set up a paper trail, like,
I just haven't taken the
obstacles.
time to jump those hoops yet.
Okay. Well, I mean, at least I laid out the groundwork for you. I hit a brick wall. It was just, it's not yours. Don't bother. They told me that I wouldn't. I think the last conversation left me with the impression that they were trying to insinuate that why are you bothering asking for your data, because you're too dumb to read it anyway. You wouldn't understand it.
Jeesh.
Yeah. No,
Yeah.
You're not going to get anywhere with NeuroPace themselves. You're going to need to get that from the doctor.
Okay.
And some doctors will be able to, like, download a part of it and just send it up. They're not going to be able to share the entire software with you, but they can
So I was
share
overreaching,
parts.
thinking I would just get the login.
Yeah, they'll just give you just parts of it. I mean, they can download specific parts and give it to you, but they have the same tablet that we do. It's just registered as the physician.
That's what I mean. I just wanted that login to be
They're
able to
not
see my own.
You're not going to be able to see it 24/7. I mean, if you want to request it, you have to request a specific piece of time that's being recorded.
So more hoops to jump through for sure.
Yeah, just more hoops.
And when I'm sitting here thinking that was a funny feeling, I wonder if that was, and I would have to jot it down. And that's usually not the first thing that comes to mind, is record the date and time and then ask for the data until like the next day if I have a worse one and I'm thinking, oh wait, yesterday I did feel kind of weird. But
isn't it hilarious that we don't own our brainwaves?
You know,
Yes.
that's the impression I get
So
too.
weird.
Now, about that natural pain relieving chemical, though, I guess I can look back and see the logic in that one. In one of the worst ones last year, this came from the half bath. You know, the wall and the sink and everything was pretty close together. So this was definitely on the way down. And afterwards, I don't remember pain. I didn't make note of pain. I don't think I've ever had like a lump any bigger than this one was on my head. But I felt the pressure. It did not feel painful. Like honestly, I think it hurts more when I stub my toe on like while vacuuming. I'd scream louder with that than I did for something that clearly should have generated more pain. So maybe those seizures releasing chemicals to improve mood, then I guess I could see the logic in that. Anybody else
Don't
ever
doubt
had
it
an
at all.
injury during a seizure that didn't hurt as bad as it should have?
Yeah, because I've had a lot of those. I mean, I've even had a seizure in a pool and then woken up after when I can't breathe. And I don't remember it scary. I remember coughing a bunch and coughing up blood and laughing. And my husband was looking at me in horror. He was like, okay, well, Medical City is closer, but UT Southwest, do you want to go there? Like, where do you want to go? And I said, take me to UT. They'll give me the better drugs.
So you actually had a sense of humor after a tonic.
I was not scared. I was not freaked out. And you would think I'd be scared because of the fact I couldn't fucking breathe. But I was just sitting there like coughing, just like on top of the world. And I remember
Wow.
walking into the ER and everyone's just like coming round towards me. And I'm just sitting there like waving at everyone with blood coming down my face. And I'm just like, hi. And they're like, oh, you
Wow.
in so much pain. You must be feeling awful. Here's some this will calm you down. And I'm like, okay.
So do they have a
Wow.
diagnosis for that? I mean, a post-ictal state where you're like that happy. That sounds like something.
I mean, it's always been coming out of a seizure for me. It's always been it's almost like being on, and it might have something to do with the rescue meds too, because the midazolam, those benzos, they make you loopy. But probably that in combination, I've always come out of a seizure. The pain for sure is I can tell because they don't give you pain meds after a seizure for, that's not a rescue medication, but I've definitely had injuries where I should have been feeling something and I didn't.
Wow, that's impressive.
Like this one.
Oh, yikes.
That looks painful.
Yep. Didn't feel a thing.
Wow. And that was some kind of just blunt force trauma, something fell on you?
I don't know. I was sitting in a chair and then the next second I wasn't.
Oh,
I
one of
was sitting in
those.
in a chair taking my exam and got stuck on this, and it was just like a really easy algebra problem. And I was sitting there staring at this algebra problem, like, what the fuck? Why my brain is not processing this? Why? And I was just looking at it and nothing was coming in. And then I woke up and my dad was like, yeah, you had a seizure. And I'm like, you gotta be fucking kidding me. But it worked out. I'll be right
Yeah,
back. I
that's an
gotta go
easy way to
grab a
tell.
charger for my computer. I'm almost dead.
We'll be here.
And actually, I won't be. I'm gonna have to go.
All right, Raven, thanks for stopping in. We'll be on for
Thanks for
20 more
hosting.
hours.
Bye.
Yep. See you soon. So the last point of this summary was that seizures may activate brain repair systems that enhance resilience to injury and disease. So it sounds like maybe in the future, I mean, do you feel that way, Melissa? Like over time, you've become less susceptible to injury and disease since being diagnosed and having seizures?
I mean, I've never thought of that before.
Yeah, it's never something that's jumped out at you.
Uh,
Yeah, I think that study sounds like they were really just trying to
Like, what question were they asking for the study? Is that just what the results of the study were? But what were they asking? You know what I mean?
That was the objective. It's the first paragraph is we explore the idea that epilepsy may activate the brain's natural repair systems, despite
Okay.
its risks. These include brain processes that help people recover from injury, infections, and reduce pain. Understanding these less frequently discussed aspects of seizures may help researchers develop novel questions and improve treatments. So it sounds like the big picture objective was to get, this information to researchers to actually be able to use it. And, it's far from accomplishing anything yet, but
I don't
it
know.
sounds like
That
they
seems
do
like
have a link.
a dumb question to ask out of, like, for me, in my mind, like, for them to be like a dumb objective, because I can think of like a million other things that I have questions on in my mind that you don't have a lot of studies out there about, that
True.
I would rather find out more about than, like, is epilepsy going to heal your brain? Or
What the vibe that I got is that if they're exposing the adaptability of the brain, would you be surprised to find out that they somehow flip this around and try to turn it into an aging thing? Try to figure out a way to program something and bring it back and say it's for memory, but then just market it as some, you want to be younger. That's
Mm.
how I'm so disgusted at them using real data sometimes, but it happens every day.
Like,
What it
my
comes down
biggest,
to, oh, sorry.
that's okay.
I think
I
what
was
it
just,
comes down to for at least the way I think about it is that they just don't know. There's so much that's not known about the brain that they can't really make any conclusions for a lot of things. I mean, they don't know so much of most of epilepsy is just throwing darts and seeing what lands. So it kind of leaves us with not much. It's just a mysterious disease in general.
Absolutely. So when you got your Melissa, what were you saying?
I was just gonna say, of all the studies, I wish they would do a lot more with like women and epilepsy. Like, just
Absolutely.
specifically women and epilepsy. Everything's generalized for like all adults or all children, but I don't think there's enough information out there on women and the phases of life, puberty in
Exactly.
girls, perimenopause. I was looking up the other day about like taking um hormone replacement therapy in epilepsy, and there's a little bit of information, but everything was like, we don't know enough to like really say if it's good or not. And it's like, there should be more information out there by now, a little bit more. I understand the brain's complicated, and I understand that it's not easy to figure out, but they should be trying a little bit harder.
Oh yeah.
I definitely agree that they should be trying harder, but as far as um epilepsy studies are so hard to put together in general because it's such a wide variety. All sorts of seizures are different. Some people have them more, some people's are more severe, some people's are, that it's trying to get a whole bunch of women that have seizures that all their seizures look alike.
And they
and
do
and
eliminate so many people from a study if they don't fit the bill.
exactly.
Yeah.
So it's not really like, how are they even going to study this when they don't have the information they need to even study it?
Right.
Mhm.
So I feel like because epilepsy medications they do help the majority of people, and these devices that are coming out commercially, they have what they need to at least manage. So there's no point in them spending all this money to try to find out what all this information that it's not going to change what they do for it anyway.
I think for me, since I'm in perimenopause, I really want more information out there. There's like nothing. There's nothing out there really. I mean, there's stuff out there, but hardly anything about perimenopause specifically and epilepsy. Because I'm always like, and they don't even have a lot of information on average normal people without epilepsy and perimenopause. Like, it's like a whole subject that is like brand new for people talking about at all in general. And I don't know, it's upsetting for me because that's where I'm at.
Yeah,
I feel like
yeah,
I'm always
absolutely.
gonna have that question in the back of my mind is what I'm feeling normal? Is this what normal people feel? Or whenever I have a symptom, is this caused by this or what, you know? I'm never gonna have that. I mean, our brains aren't normal. We don't know
Yeah.
why. We
Exactly. Your
don't know what
version
it's
of
doing.
normal is yours.
I've been
We have no idea what the perspective is from the normal side, and the normal people don't understand what it's like for us to be. So it's that complete disconnect. I mean, no matter how much research they do, that's not going to go away.
Yeah, absolutely. So welcome, Lufa. Thank you for joining, of course. Lovely to see you. The question that we first asked today when everybody joins is, how did your epilepsy diagnosis influence how you feel, you know, as a woman? Did that change your perspective on anything when you were diagnosed?
No, it just made my life as a woman harder. Especially with the like feeling aspect of it, because during my period it gets really, really bad, and I become a monster to society. And I think that my epilepsy plays a huge role in that.
All right, Melissa, you know, we'll be here. See you in a bit.
So yeah, that's
Yeah, I think it probably makes a difference too between on like what stage in life you were diagnosed at. I think me and Hannah were diagnosed around the same times when it was like puberty, like high school
Yeah.
ages, right? What about you, Lufa?
you guys.
30.
No,
Three.
how old were you guys when you got diagnosed?
Oh,
Sorry.
I was 16.
Okay. And how old
That
were
was the diagnosis age, though. I was probably having seizures for a little while before that.
Okay. How old were you?
Was diagnosed at like, I think 12 or 13, pretty much as soon as I started puberty.
Okay. I was diagnosed at 20, I think. Yes, 20.
There you go.
I'm 20 now.
Okay. So you got to have some of your fun teen years.
Yeah, I've been
You
having,
just get diagnosed?
yeah, I just got diagnosed.
How
But
old are you?
I've known that I've had epilepsy for a few years now. They,
Okay.
tried to do the little, why is this not working? They tried to do the PNES, BS,
I
and
have that. Yeah, they tried to pull that with me too.
they tried to say it was part of the tardive dyskinesia that I had from a medication side effect, but it didn't go away.
Trying to explain it any way they can. That
Yeah, anyway,
Yeah.
so they don't have to add on another
yeah.
type of doctor to the insurance. Why is this not working?
What is that? Is that mascara?
It's a cat laser, but it won't.
You've been
Those are
like
tricky little things.
you've been fidgeting with that thing for like 5 minutes.
I will make it work.
But I got when I was diagnosed, had the first seizure I actually had a seizure. My mom told me I was 6 months old and had a seizure from, like, having a fever, and then the next seizure after that, I was 12. The first tonic-clonic seizure I was 12 years old, and they didn't know I had epilepsy because they didn't know I was having those absence seizures, and, so I had a seizure outside of my vet's office, and the vet came outside, called EMT, sent me off, and I went to Children's Hospital in Dallas, and the neurologist was talking to my mom, and my mom, like, they had finally gotten me to they had, like, gotten me out of the cluster. They got me out of status. And when I was, like, kind of awake and talking to people, my mom talked to the doctor and was like, "Hey, so she's fine now, right? She's talking to everyone." And the doctor said, "Well, there's no one home. The best way to explain her brain right now is this." And then he just went, and that's how he
Wow.
explained it to my mom. But so they didn't I was diagnosed with epilepsy first, and then years later was diagnosed with the psychogenic seizures because they're like, "Okay, well, press the button if you feel weird." All right, sure. All right, you have psychogenic seizures. Nice to see you. Bye.
And that was an ER thing, or that was an actual inpatient sleep study type setup?
It's the EMU.
Oh, okay. So that reminded me of this post here. Somebody saying, I had my first non-epileptic seizure after being brought out of anesthesia. They woke me up too fast and caused my brain and my body to disconnect, resulting in a 2-hour seizure. I only remember hearing a doctor voice saying, "Wake up," and then waking up on the floor. The neurologist said, "I'll probably have these for the rest of my life," which sucks. So this person is saying they actually got the diagnosis of epilepsy after their first seizure being brought off anesthesia. I didn't think that was how it works. You know, if they're saying that
Doesn't sound like epilepsy. That
Would you
sounds
be
like
allergic to the anesthesia?
that's
that
what a
sounds
lot of
like a
the
reaction to the
yeah,
anesthesia. That's like a not just an acute reaction. It doesn't sound
Like,
like epilepsy though.
my mom is allergic to high morphine.
Hydromorphone?
Yeah, like if she like the shit that they inject you and make you all fuzzy, whatever.
Dilaudid?
Yeah, all that fun stuff. Because she had 16 jaw surgeries, so she found that out. And she stopped breathing. So it could very well be a reaction to the anesthesia. Also check what type of anesthesia it was, because they do different types. Now I don't know what type of surgery they had, but I had a really bad reaction to an anesthesia knockoff. It's like a benzo anesthesia. I don't know what it's called, but it made me so sick. It made me,
Versed?
I don't know, but it was curse it. Curse it.
There was a
Negative
okay.
energy gets way.
I have a bad reaction, and it's funny because it actually um I have a bad reaction to anything that's similar to Haldol. Um and Haldol is like a medication, like they kind of tranquilizer sort of thing. I think they gave it to me in the ER once for, I'm not sure if they were doing it off label for pain or what they were, I don't know, but they gave me Haldol, and the reaction I had was called akathisia, where my body was involuntarily moving like a seizure, but I was completely conscious and could not stop moving. So I was
Oh.
sitting there like, oh my God, I can't stop. Please help me. Like, knock me out. I can't stop. And I just sat there like that for like an hour and there was nothing that they could do.
Wow.
That sounds like the opposite of what I had, which was I was on Abilify, which is an antipsychotic, I believe, and it gave me tardive dyskinesia, so the muscles in my eyes would get stuck rolled to the back of my head for hours, and I couldn't do anything with it. And we couldn't do anything until they came back. So
Yeah.
I was the girl from the TV. That was my nickname.
What's the problem with a lot of these chronic stuff is that most of the time, if it's not a quick fix, it's pretty much you got to just get used to it or figure it out yourself.
Yeah, and they never really try to personalize it for you.
Well, I
Hey,
mean,
Lupa,
they
are
don't
your
have the
seizures
fucking
catamenial?
time.
Yeah. When you're talking about that patient to doctor ratio, that is pretty difficult. So what we were talking about for a while at the beginning here was catamenial seizures. Are you more sensitive around hormonal changes?
I'm sorry, me?
Yeah, are
Yeah,
you catamenial?
she said hers what her
Oh, okay.
Oh, yeah. We call her Period Olivia. She is nuts,
That's what it was.
crazy. She's insane. Like genuinely, like if I don't have my, what is it called? What's the birth control called? It's
A pill or an injection or
she's in
a
me.
IUD? IUD.
IUD. She's in my uterus. It was very
Mhm.
painful. Mirena, the Mirena.
Oh, okay,
It
there
was
you go.
so painful. But
Yeah, I have that.
as painful as it was, the benefits equal the amount of pain. So it's just as good as how painful it was. So that was a lot of
I
pain.
mean, is it still painful after the implant or was it
No.
just the Oh, okay.
No, I don't get my period at all.
It's like a 30-second pain when they're doing it.
No, I don't know if she did something wrong. I don't know if so I've always had problems with my uterus, and in my opinion, I think something's wrong. Because I would get my period for 6 months at a time and be like heavy bleeding, and I couldn't wear tampons because if I wore it for over an hour, I'd be at risk for what is that called?
Like where you lose too much blood?
Shock syndrome.
Yeah.
Because it would be so full already. I slept with diapers on. I couldn't go to school because of how much I was bleeding. So in my opinion, I think something's wrong with her. But when the lady put it in, they were like, it looked horrifying. I'm not gonna lie. Every time I've gone to the gynecologist and they put a speculum in, it is the most painful thing in the world. It does something to the soul. And
Do you have chronic pain like just on a regular in the pelvic area, like around your periods?
I have it all the time. There's some days that I don't have it, but most times I do have it. But the pain before I got the Mirena IUD was like unbearable. I would compare it to like contractions, because I'd literally be like a woman having like I've watched videos of women having like contractions, and I'm literally in the same type of position doing the same thing. I do the face down, ass up all the time. But it's like my part of the problem was because I tried the one on my arm, but I needed the bleeding to stop. And when she inserted it, it was so painful. It felt like I just paid to have myself essayed. And it was so, oh my God, I could feel every inch of it.
That sounds like it took way too long.
That's interesting because I
Yeah.
have pretty much the same symptoms exactly.
Yeah, no, it was, I felt every single part of it. And she's looked at my mom and she was like, should I stop? And my mom was like, no, like just get it over with. You're already inside like the area, so like just get it over with. So, but ever since then, my period stopped. I get some spotting here and there, but they say it should last till I'm 30. So, but I don't know. But
So they're calling this a condition that's going to change with like your life stages?
what?
I mean, how do they say predict that this condition's going to stop in your 30s? Are they saying like when you enter perimenopause or like a different life stage?
Well, they're saying the Mirena lasts until I'm 30. Like it
Oh, okay, that's what they're linking it to.
30. I think that there is something wrong. Like
Well, if it sounds like endometriosis.
That's what I've been saying, but
because I had that same thing, and they pretty much said, yeah, it's probably endometriosis, but the only way to confirm that condition is through surgery, and the surgery typically makes things worse. 10% of people, 10% of women, I think, or more have endometriosis, and even higher, I think, with epilepsy. But I have that was the reason, because I have the chronic pain in the pelvis too, and that's actually when I had Katie, you know how I told you the medications were hurting my kidneys and I got that kidney infection?
Yeah.
It spread throughout my body and I didn't even realize that I had a kidney infection because I was so used to the pelvic pain that I didn't think anything of it when it started to get worse. I took I had a oxycodone or something, like I'll stockpile meds or something, like if I have surgeries or whatever. So I took an oxycodone and kept going. And then my dad was
Your
like,
liver
hey,
felt it.
you're
Your kidneys
need to go to the hospital. You have 104 fever. So I was like, all right, let me take this test and I'll be right there.
Yeah, my friend has endometriosis and she has, I call them PPV because I call them pussy popper Vicodins because that's exactly what they are. And I have my ghost period still, so I still have like that time. And it's never like the thing with my period too is the cycle is like whatever it wants. It's on its own time. Whenever, whoever, however long it wants, however short it wants. It could be it could be a day, it could be months. I don't know. So every time that they would tell me to track it, I'd be like, I don't know what the fuck to tell you. So I tried the PPV and oh my lord, it was like,
Do you know the name of that drug?
I don't know, but it was like Vicodin, but you put it up your coochie. And it was the most beautiful feeling in the world. It was so great. Like that should just it was great. It was very nice. My friend has endometriosis and she was like, try this. And I was like,
Sounds like estradiol. 1 second.
yeah, I don't know, but I loved it. It was great. It took the pain away and I was like, I didn't even know you could feel like this because it always hurts. It always hurts there. It always hurts in that area. And I just learned to live with it.
I want to try that PPV because I've been trying to get mine under control for a very long time. And I just figured that's not going to happen. But
I honestly don't know what to do about the endometriosis because,
So you said the only way to diagnose it, is actually getting the surgery.
yeah, and I don't want to make it worse.
And that's the reason they don't typically do the surgery. So they don't even diagnose it most of the time because the surgery to diagnose it typically makes it worse.
Yeah, I
So
don't
it's
want
one of
to
those.
Scar tissue.
I don't want to, yeah, because endometriosis feeds on scar tissue. I don't want to
Gotcha.
make it worse, and the Mirena IUD right now is doing the best that anything has done, so it has helped tremendously. So it was very painful to get inserted. It was not painless, but totally worth it long term wise. If you
Understandable.
don't deal
I
with
feel the same way about my brain thing implant. I mean,
Yeah, that's how they sold it to me too.
hello, Sia.
So Sia's here. Yes, welcome. So happy to see you.
Hello.
Love the glasses. Rocking those.
Oh, these are my broken ones. The other ones gave me a TC yesterday.
But that's why I'm saying the broken ones are totally your fit. They
They're
work
better,
too.
yes.
There you go. They serve their purpose. So happy
Yes.
to see you in those. The first question for today was, how did your epilepsy diagnosis make you feel as a woman? Did your perspective change on anything?
Um, I think, for me, with the way that I was diagnosed, everything kind of happened at once for me. So, I had already been going through about a year and a half worth of hell with the endometriosis and the adenomyosis. And so when I got the surgery and then 2 days later ended up in the hospital with the seizures, and the hemorrhaging, that it was it's like it changed my perspective on what I thought was so bad. And I was so obsessed with like trying to get the endometriosis and the adeno under control. And I had to take a step back when the seizures started up, because I realized like, okay, this is not what's most important anymore. And so I think it changed my medical perspective. It taught me a lot about doctors and how to handle them, because I was going into it very naive with the previous conditions, just kind of trusting whatever they told me. Um, and that led to, the issues that I experienced with her doing the surgery, my surgeon, and screwing it up, and then now I'm left with things that are lifelong and can't be treated. Um, and so, yeah, I think for me and my diagnosis, it changed my perspective on a lot of things. And it also just really helped me understand what was most important. I was very depressed, because of the constant pain that I was in. And I've gotten to a point now where even though I'm still in daily pain, um, it's like I don't notice it the same anymore. I still push
Wow.
myself to get out there and do things and be there present in the moment, versus before I kind of put myself into a shell and hid away from the world.
sounds like a lot of growth.
It was, yeah.
We talked a lot about that earlier, that
Adapting.
learning how to talk to your doctor is half the battle. Like, you wouldn't think that would be such an issue with most diseases, but with something like epilepsy, where you're just kind of throwing your hands up and guessing,
Well, yeah, and
you have to
especially
do.
too with like the fact that just like with epilepsy, endometriosis is so widely, uh, misunderstood, and there's just not enough information out there for it, not enough resources. I mean, the fact that we have to get a surgery in order to be diagnosed is just pure insanity. And
I
it's
don't
so
even have
unfair.
diagnosis right now. When I went to see the last time I went to see the urologist, because I never really established care. Like they would tell me, okay, do this, and I could hear the bullshit and never really went back because nothing they did helped. But every once in a while the pain would get so bad and I would just go. And last year I had my seizure meds had worn down my kidneys, so I got a kidney infection. And I could tell the pain was getting worse, but I just thought it was I didn't think it was a kidney infection. I thought it was just the endometriosis like flaring up. So I went to the urologist while I had that kidney infection, like the week before I was hospitalized, and they said, "Oh yeah, just pee in a cup and you still need to go do pelvic floor therapy. That's why you're in pain."
Was
Because
that supposed to strengthen muscles? What was that supposed to do?
It's supposed to be therapy for the pelvic floor muscles because they believe that strengthening them leads to less pain, when in reality, exercise is a trigger for a lot of women with their flare-ups. Like for me, that is a trigger for me too. So it's not a fix-all, and it's kind of sad that that's what they go to.
I was in the hospital for a kidney infection because I couldn't tell that I had a kidney infection because I was in so much pain and I was used to the pain. So I didn't think that anything was wrong, and the doctor didn't even bother to look. So because she didn't really look, she was a nurse practitioner, of course, but then I ended up in the hospital for a week with a kidney infection. And anytime, even in the hospital, when I was in pain from the kidney infection, they would be like, "Oh, well, you have chronic pain and you have pelvic pain, right? This is normal for you." And I'm like, "Well, yeah, but if I'm inpatient, give me those fucking meds, because if I'm inpatient, I'm paying to be treated. I would
And
like to
monitored.
not be in pain at least while I'm here."
And also, too, just because it's normal for you doesn't mean it's normal. They should
Yeah.
be actively going into these things to try to solve them. It's unfair to have to live in pain all the time just because it's a statistic.
That's totally unreasonable. So these exercises that you guys are referring to, is that the same as Kegel exercises?
I mean,
That's what I'm familiar with for like bladder issues.
that's for like bladder. And it can help to have that strengthened as well, but for these muscles, I think it's the abdominal wall and
Yes.
the I forget what they're called.
Okay, so
But
it's more than just like tightening. It's actually doing like lifts or
yeah,
something a little more extensive. Okay, I see what you're
It's
saying.
yeah.
it's also trying to pinpoint locations, because I was told that when they told me to go to therapy, they told me that I don't need to strengthen my muscles, that I need to learn how to relax them,
Hmm.
because they were and that's why I was in pain, is because they were too stressed. But that's kind of, and the only reason they thought that is because I told them that it helps, a heating pad helps.
No.
So that's where they wanted to send me. But at that point, I mean, none of the medications they were giving me were helping. The only thing that was helping was a heating pad. Like literally, I took all of my Oxycontin from my last surgery, and I had held on to it because I don't take it unless I really needed it. And I had taken the majority of that for this, and it wouldn't work. like I was in so much pain. The only thing that would help was a heating pad.
Did you sleep
At
with
least
that?
try it. Huh?
Did you sleep with the heating pad?
Yeah.
Oh, wow. Okay.
I got
Joyce
a
was on earlier today saying that she just figured out that sleeping with the heating pad doesn't work for her. It doesn't help.
the heating pad, it doesn't stop but my when I
I
get
think
a
hers is
flared
lower back,
pelvic,
like
I
lumbar.
have a problem with incontinence as well, and I can tell when a flare is about to come on when like I get an instant feeling where I need to pee, and then I go pee and nothing comes out, and that's when the pain starts, and then it just starts being like that, and then the pain will just get more and more and more intense, and it's always around my period time, and um they I mean they know it doesn't have anything to do with my actual urinary system. They've already done those tests, so they told me it's most likely endometriosis, but I'll never have that diagnosis because I'm not going to get
They
that
won't do the
surgery.
surgery.
But
Wow.
either way, there's not really anything that they can do to treat for the endometriosis anyway.
Well, yeah,
That's
because the surgery itself, like you guys were saying earlier, it can cause it to worsen, which
I,
it has in my case. I started at stage 2, and now I have DIE, the deep infiltrating one, and that can happen for so many women. Like I think it's such a small percentage of women who end up having even just a year long period of time where they don't have pain. Mine was only a month. Um, so yeah, the surgery is like, the gold standard, like Keppra is for epilepsy. But the medications otherwise, all they do is put you on hormonal birth control, and not every single woman is going to be able to handle that very well. And
I
so
mean,
they don't have a whole lot.
they go off the fact that 10% of women have endometriosis, but that's only the number of people that have actually been diagnosed with it. And that is an insane amount of people for there to not have any other options, like treatment wise, besides birth control or surgery that makes things worse.
Yeah, talk about unacceptable.
I
Well, and then
just,
also too, like the adeno can be cured, I guess, by the hysterectomy. But then if you do end up getting that, because some women have the comorbidity between the two, if you do end up getting the hysterectomy, the endometriosis can continue and spread to your other organs and just continue there. So there's just nothing. There's nothing for endometriosis outside of just the birth control and the surgery. And it does more damage than good most of the time.
I spent years after I got diagnosed with because I got um my I got diagnosed with epilepsy at 14. I was pretty much running around like a zombie until I was 18 because I was having so many seizures and all the different medications. And then once I was 18, that's when I started to get all of the chronic pain, weird symptoms and stuff. Well, I got it before then, but that's when I stopped taking my meds because I was like, fuck it, it's not doing anything anyway. So I stopped taking my meds, and then I thought that all those symptoms would stop, and they didn't. And I spent years trying to chase down those symptoms, trying to figure out what they were, and trying to get help for the chronic pain and everything like that. And all it ended up doing was bringing me to pretty much bankruptcy, and there was nothing that they could do anyway.
Yeah, I hear you on that. The amount of money that goes into the roundabout circle that they send you on. Go to the gastroenterologist, go to the urologist, go
Literally every
see
ologist.
yeah,
So
like
if they
every
feel
single one.
all if they feel all of those systems are connected, I mean, incontinence is something that happened to me for a lot of seizures before the RNS. Did that ever cause a flare up with some of your comorbidities, like a longer seizure that causes things like that, the incontinence? Did that like
Oh,
reflect
that's a
as
question for me.
pain?
Actually,
Both of you, yeah.
like the incontinence is not really related to my seizures at all. Like,
Okay.
remember how I told you the other day, not the other, when I had that seizure, I used to be incontinent during seizures, but now I'm like, I'll go and go to the bathroom after a seizure,
Hmm.
and like I'll hold it in, but I'm incontinent whenever I'm in pain having these pelvic flares. But yeah, so it doesn't have anything to do with my epilepsy, the incontinence. It's just
Okay.
it's probably just the endometriosis and how it's presenting, because that presents different in everybody too. That's what the doctors told me, but they pretty much said, and I appreciate the doctor that I talked to about this. He was like a specialist. He was an OB and a urologist. And he's like, look, I'm gonna give it to you straight. I see all your tests here. I see what's going on. You most likely have endometriosis. And here are your options. We can either cut into you and make it worse and give you a diagnosis that really won't change anything anyway. Or you can try pelvic floor therapy in a hot water bottle. But that was
Wow.
already after I'd already tried all the medications that they use to treat endometriosis at that point. So him saying, look, I'm gonna give it to you straight, I appreciated that, because I didn't want to waste any more money trying to chase this if there wasn't anything I could do anyway, you know? I prefer for him to tell me that instead of, just not saying anything, and you know what I mean?
Yeah, they just
The
like
mystery of
they
it.
said this is what your options are and live with it basically.
But
That's definitely
I'd rather have someone say that to me straight than spend years and hundreds of thousands of dollars chasing it, thinking that there's hope of, and never actually, because the changing point was when I had to sit down and be like, okay, this is my life. I need to do the best I can and take care of myself instead of just throwing it at the doctors and paying them money to figure it out. I need to create my normal.
and just believing them and kind of going with the flow of whatever they suggest. Yeah. So the next question here was, would you rather do without seizures or your period?
Both.
That's an easy one. That's an easy one.
That's
I
all
would definitely do
seizures for
without the
sure.
seizures. Yeah.
But I would rather not give up the diagnosis of epilepsy, because I like the extra time and stuff on, the perks, the epilepsy perks. I appreciate them.
I'm surprised you wouldn't be able to get that with the comorbidities. You do still have symptoms of these other diagnoses that technically you should already have, but that might cause a slowdown. You got to go
Oh, I know,
feel
but
better.
there's a little bit of a difference between calling someone and saying, hey, sorry, I missed that appointment. Can I get a refund? I had a seizure. Instead of, sorry, I missed that appointment.
I'm having really bad cramps.
I was hurting real bad with my cramps. Yeah, it definitely,
Has a different ring to it.
yeah.
So what about you, Sia? Why would you do, or which would you do that?
I mean, I would want to do both, but if I had to choose, I honestly think I would go without the seizures more than the period. The issues that I experienced with all of it, like yes, I have to take Zofran. I I can't take pain medications anymore. I have scars on me. It sucks. But the seizures have been the scariest part of everything for me. The possibility of having a brain bleed, my eye bleeding, my nose bleeding, my ears bleeding, all of that, like just everything with my head has been far more intense.
Terrifying.
Yeah, it's been far more intense than, you know, it that's why I said earlier, like it put it into perspective for me because I was like, okay, yes, this pain sucks, but I can lay down in bed for a little while, let it pass eventually. And it's 1 week to 2 weeks out of my month. But then with the seizures, even on the medications, the Keppra, it was doing good at first, and now it just completely tanked. So I only get 1 good week out of every month, and it sucks. So yeah, I would go
Thea,
without the seizures.
be careful because the medication that gave me the kidney infection was the Zonegran, and I didn't
Monogram.
feel it because of the pelvic pain that I normally get. The only way that I knew that I had to go to the ER was 104 fever. So if you ever get the pain with the fever, get it checked out.
Okay. I appreciate you saying that. I haven't had um as many issues with my bladder as much as I have with my colon, which sucks. But yeah, the back and forth, that's why I'm on the Zofran, even though it has the interactions with epilepsy, with seizures. It can lower your seizure threshold. I get such severe nausea that I lost 80 pounds in a very short period of time. So
You should
it
smoke.
I take
I used to.
stuff too. I take um well, Loki, I take my grandma's that she had. I took her stuff when she passed away because I'm the one that needs it most. So she
Yeah,
had
it helps. It really does help.
she had
Wait,
some
what?
yellow
Which one?
stuff, and I don't know what it is, but it helps so well with the nausea. It's like some really good nausea stuff because she was on like the morphine sulfate and whatnot, so it would make her super nauseous and whatnot. But
Is it a pill?
yeah, it's like a yellow pill.
Sounds
Um,
like promethazine or Zofran.
Zofran is like normally I think a little white pill or a dissolvable pill.
yeah, but this one is like it was like a prescription.
That sounds like promethazine,
It could be.
but
But it does great when I feel nauseous, and it really helps.
Yeah, when
I
you're
only
feeling that
take it,
nausea, you cannot eat
yeah,
whatsoever.
I only
It
take it when it's like really bad because I have
yeah.
limited supply, obviously. But yeah, it's
And
well,
that medication isn't any kind of cannabinoid for the nausea.
Cannabinoid? Oh, are you
Right,
talking about like
no,
CBD?
the
that's not weed.
mm-mm.
oh, okay, that's not the medication that she's
No,
referring to. That wasn't any kind of cannabinoid
it's
that
an antiemetic.
oh,
It's
okay.
a prescription.
Yeah, I've never heard of that one.
Yeah,
They
there's
got quite a few out there.
I wanted to try the scopolamine patch for the longest time because there was less interactions with the seizures with that one, but it's so hard to get, and they usually only give it out to cancer patients. But
Yeah,
I had that for I think it was like 48 hours after my surgery, and it was like the first time I had zero symptoms of any sort of nausea or stomach issues.
Really?
That
Yeah,
sounds amazing.
it's very strong.
mm-hmm.
Well, I that's the medication that they use for the dizziness as well. Like, no, okay, I'm thinking of something else. Because the scopolamine patch, there's one of those, not one of it's either that or something else that they said works as well as a placebo. Like it doesn't really do anything besides it doesn't do any better than a placebo, but I don't think it's that one. I think it might be the one. It's like Gas X. Gas X is the one that's not any better than a placebo.
Oh yeah, that
Um,
one's like over the counter.
Yeah.
Scopolamine's like pretty heavily regulated. My father-in-law was on it with his leukemia medications because he was like in such bad shape. Like it's kind of weird how similar it was for me. That's what kind of got my
what kind of
doctors to
insurance do you
thinking.
have?
I have Anthem right now, but I was originally on Blue Cross.
Prescription wise, who's your PBM?
I have Express Scripts right now.
Um,
They had a hard time filling my nasal am. That was rough for them.
yeah.
What, based
So
on
I
cost, or did you have to get some kind of authorization?
It was based on cost, and then they also were like super sketched out about how strong of a medication it is.
you had to get approval.
Yeah, and it took like a whole month.
Wow.
If you have any if anyone has any questions about trying to get their medications approved through insurance, please give me a message because I can help you with that for sure.
Work your magic.
That's one. That's probably the main reason that I'm working with Caremark is because they are the best epilepsy job you can get.
Hey, it's a beautiful thing if you want to share what you're good at. I mean, that's why like 9 out of 10 of us come back here so much because we know these seemingly irrelevant things about how to help what we go through ourselves. And if it helps makes a difference to somebody else, like I was really impressed to hear, Hannah, that you got in touch with a doctor so soon that actually wanted to go through with the VNS, wanted to go through with all the tests that it would require to get to the source of, like, get you approval for that surgery. They would have to prove what kind of seizures you had and that this would help. And getting to that center, maybe those level fours, the epileptologist really would have been like the right way to go from the beginning. I driving those 2 hours to get to that doctor, maybe I should have gone that route. Do you think your level
Well,
4 really made a difference? Like you saw the right doctors?
yes, absolutely. If I was treated in Medical City, I probably would be dead by now. So,
All right.
well, I mean, but keep in mind, I spent about a decade and I went through over 20 medications. And by the time they were considering me for a VNS, I had no other options left. They didn't want to go through with that, but they knew that they had to, or else I would most likely not make it. So that's why they did that. There was no, if anything, they tried to convince me. Cause I just, at that point, I was just so tired of being on all these different medications and feeling like a chemo patient and all of this shit that I was just like, you know what, whatever you need, just get me off these meds.
Yeah,
Yeah, that's what
that's
got me most excited
understandable.
about the device too. The promise
Yeah.
that it was going to stop. I mean, did they kind of sell it to you like that though? I felt totally gaslit after the
Well,
RNS got turned on.
they said, even with this device, you will most likely have to take multiple medications for the rest of your life. As soon as I got the VNS, um, immediately my seizures were less severe and I would come out of them faster. Over time, they became less frequent, but they were still bad. And I ended up starting Xcopri. And now I only take Xcopri and Klonopin. I mean, Klonopin as needed, but um, I used to be on the highest doses of 4 or 5 different drugs at a time, and now I'm just taking one, which is great. And hopefully after they turn on the RNS, I'll be good to go. Because I was still, one of the main things I was concerned about was, I mean, the whole political climate, everything's so expensive. What happens if I can't afford my meds? I didn't want to have to rely on that when,
You know you're going to get
especially
hooked
with
after
what
the
I
first
do, I
dose,
know how
basically.
hard it is to rely on medications like that. So I was like, you know what? Do everything you can to give me as much coverage, as much protection as you can, and whatever, that's fine with me. It makes me feel better knowing, like, if I miss a day of medication, that I'm not going to have a seizure immediately, that I have at least a little bit of fallback.
Yeah, that's definitely reassuring to
Did
have
you
some kind
feel
of
it when
plan
they
B.
turned it on?
I didn't feel it as much as I do when they program it. Like, you know, when they're adjusting the settings and they say, okay, it might zap. I think I only feel that. I didn't take notes of feeling the RNS, like no extra notes on the RNS day. And I know it's been a couple of years now, but I probably would have jotted that down if something felt weird.
Yeah,
So no,
I'm
I don't
excited,
think I
if
felt it.
anything, because they're going to turn it on in about a week. So fingers crossed.
Yeah, absolutely. No, so are they planning on if the RNS takes hold, doing what it's supposed to, is the VNS chance maybe gonna get taken away?
No, they have me on the highest level for the VNS,
Okay.
and because it's supposed to work over time,
Hmm.
they want to leave it on as much as I can handle. I think they're hoping to take me off, like reduce my medication, because my medication is still, it might be just one medication, but it's still like one of the higher doses. So I think if anything, they're just going to try to make it so that I rely mostly on the device. But I do have to pop off. Thank you for I mean, it's been great. Thank you so much.
Absolutely. We're here Tuesdays and Fridays are the regular days for meetings, 12 Pacific time.
And we're
Okay.
happy to meet you.
Yeah, very happy to meet you.
I guess I'll see you guys Friday then.
Thank you for
Sounds
contributing. We'll
good.
see you then.
We have a new
And
person
welcome.
in.
Yes, please take it away.
Hi, Nikki.
Hi,
Welcome
how
in.
are you all?
Good. How about you?
Oh, rough day, but yeah,
Well, now you're here to
struggling a
kick
bit.
back and relax.
Yeah,
Yeah,
I
it's
like your
comfort zone
hair
here.
out.
Oh, thank you.
How are you, Lufa?
I'm hanging in there. How are you?
I'm doing all right. Yeah, hanging in there. I went to my neurologist today.
How did that go?
Um, well, she told me to go back to my epileptologist. But
Okay.
I don't know. I think I said that before when I was on here that they diagnosed me with FND and PNES. Um and so right now I'm not on medication, and basically every day I'm having seizures. Um and so I they want me to go to a psychiatrist um and uh, speech therapy and occupational therapy. So yeah, my brain is fried, but
So,
yeah.
in advocating for yourself, how, I don't know a better term. I mean, just how stubborn are these doctors in not believing that these are physical seizures and not the, the kind that look like seizures, but they're not? Is it really all based on like one clean EEG?
I had multiple. Well, I had a couple of 30-minute ones, and then I had two at home ones that were 72 hours. And then I had a EMU stay. That was my first one, was 72 hours. We tried the Keppra. I was on that for about 5 years, and it really didn't stop these. And I had a brief period where it was okay, but they said maybe that was a placebo.
Really?
And then uh, I forgot what I was.
The Keppra, you were on the Keppra for 5 years, but that didn't really help much, and the
Yeah,
seizures
yeah.
didn't seem to stop. I mean, I'm just trying to figure out why they're not actually trying to get to the bottom of this. If you're not getting better, you are feeling worse now that you're not taking any AEDs.
Uh-huh. Yeah.
Do you feel like anybody is being proactive about diagnosing you
No,
correctly?
unfortunately, well, they did, my epileptologist did tell me I could get a second opinion. Um, that doctor I don't get to see until January.
Mm.
And yeah, she also said I could get another EEG. But yeah, I'm guessing it will probably be normal because whatever is going on, I think it's deep in my brain and it's not gonna be picked up on an EEG.
And nobody's mentioned subdural EEGs to you.
No, no. They they wanted to see, they wouldn't even adjust my medication until I had a EEG that actually showed a seizure. So I was on that same 1,500 milligrams of Keppra for 5 years.
Did you make note of feeling a seizure during any of these EEGs that should have shown
Uh-huh.
up?
Yeah, yeah. Yeah, that's why my second EMU was 20, it wasn't even 24 hours. And I had
Okay.
14 events, and they came in, they say, yeah, you can go home. It's like they're not showing on the EEG.
But you're
But
having events in front of other medical professionals, and nobody's
mm-hmm.
talked about escalating it to the EEGs that could see deeper.
No, no, that has never come up. It's just been um, psychogenic, or now most recently FND. And because when I have the episodes, I lose my speech, or my ability to speak is, uh, I can't get my words out. That's why she said to go, she wants to refer me to speech therapy, occupational therapy for the TODS paralysis, and um, psychiatry for an evaluation.
Okay.
So,
So do you plan on at this point just bringing your suspicions to the second opinion in January?
yeah, yeah, I'm gonna
Okay.
do that.
And
Yeah.
maybe asking them about another EEG that would see deeper?
Mm-hmm. Yeah, I'm sure that that
Okay.
doctor will
So
ask for it. Usually they do that. As soon as they see you, they ask for a EEG.
right, right. But at
So,
least you can mention that you've had EEGs before and the
mm-hmm.
symptoms. I mean, do you have any symptoms that might indicate like a hippocampal foci? I mean, is it always memory or?
I I don't know. I mean, from what I've researched just on my own, my suspicion is there's something um, in the parietal lobe because of my symptoms. I get a lot of tingling and like I get the roller coaster stomach thing, but I also get tingling and pressure sensations, and also when I do twitch, it's very slight twitching, like you almost can't even see it. And most of the, I guess, the disturbing symptoms are like just feeling like sometimes like my leg is not quite there, or my arm
Mm,
is not, and it's always on the left side, it's always on the same side. And I kind of lose my balance and I get disoriented. And
okay.
yeah, my speech, they're very different. So I think that uh, I'm starting to see that that's kind of probably the reason why people think I'm making it up, or maybe,
Yeah.
that is like um, psychological. But when I did some research on parietal lobe seizures, and I've seen a few people post on the epilepsy subreddit about them.
Right. I'm seeing like
There,
the visual illusions, that tingly feeling
yeah,
that you described, some numbness.
uh-huh,
Okay. So I mean you have your suspicions of that, but this is also, has to be diagnosed by EEG, same way.
exactly, yeah, and it's hard
Okay.
to get them on an EEG because I think they're just in a very tiny, tiny part of the brain that's causing those sensations. So yeah, the reason why I don't think it's FND is because they seem to be triggered by the same thing that regular seizures are triggered by: the heat,
Okay.
uh, like sunlight. If I'm riding in the car, the sunlight going through the trees.
Whereas
And
FND is more psychological triggers, the stress and whatnot.
um, I don't, well, I think FND is more so it is a stress response, but I think it's like a long-term stress response. So it is
Oh, okay.
possible that, it could be both. But when I look at the F and D symptoms, I mean, like, some people wind up having problems with walking and talking, but it's more of a long term. It's not so much episodic.
Okay.
Um,
Yeah, that makes sense.
yeah, and I guess they're still learning about all of that stuff. So, they could say, "Well, you have that too, and we just haven't seen it yet." I don't know, but
And there's
um,
never a straight answer for anything.
yeah, they're still learning about it. I do believe that there is something there as far as like people who have been in very stressful situations and now their nervous system is trying to deal with it.
Compensate after the fact, yeah.
Yeah, yeah, I do think that that is very possible. But um, for me, I don't think that that's the case because of the triggers. And also, it's like if I don't eat, I have to make sure, and it's been this way my whole life, that I have to make sure that I always have some kind of food. If my blood sugar gets low, I get those
Oh,
symptoms. Like I said, the heat, this sunlight. I actually am one of those people that's photosensitive. So when I went to the
oh,
eye doctor yesterday, all the things they do, they flash the lights in your eyes, and I was really a mess after that. And
yeah, that probably caused some stuff.
yes, it definitely did. And I went to the
Mm.
dentist too yesterday. So
Oh, and those lights, those are a different kind of bright light.
yeah, yeah. At least I had the glasses on for that, the dark light, the glasses. But yeah.
Yeah,
Eh,
pretty little doctor glasses. We
yeah,
all know
yeah. I
about that.
always try to keep them.
Exactly. Let
Huh.
my children want to dress up in something, and that'll get it done.
Oh, the glasses.
Yeah, yeah, that's a easiest dress up. Way better than having to dig out the Halloween costumes again.
Oh.
So we asked a question a little while ago, and I don't think I even got Lufa's answer. Would you rather give up seizures or your period? If you could do without, which one would you definitely do without? I went with seizure.
Seizures. Because I don't like the medicine.
Okay.
I hate the medicine. I hate the seizures, but I hate the medicine as well. So it's like a lose-lose
Yeah.
situation for sure.
Yeah, that makes sense. What about you, Nikki?
What was the question?
Would you rather go without your seizures or your period? If you could get rid of one or the other.
Oh man. Well, I feel like my period is causing all the problems. So I feel like if I got rid of that, then I probably wouldn't have as many seizures.
Oh, okay.
Definitely. Yeah. And I have
Yeah.
brought that up to my doctors many times.
And did they ever try to go like an IUD or a depot route? Just messing with
No,
your hormones? Okay.
no.
I wonder why. If you bring that up to the neuro, they don't even talk. Or no, you said OB, right?
No, my neurologist, yeah.
Oh, okay. And
Mm-hmm.
they didn't even try to tell you to talk to your OB about it?
Mm-mm.
Wow. So that was just like letting you vent about it and say, okay, best of luck.
Yeah, right.
Oh, that's got
They
to be
act
so
like they're
disheartening
so
when your doctors
puzzled.
just don't listen to you. Or
What's
they're
that?
confused. They're acting more confused and not like they're just not listening.
Mm-hmm. Yeah, like they just don't like. I think that once they have like an idea in their head of what they think you have, then everything else is kind of dismissed. It's like, okay, you just need to go to the psychiatrist and, they can help you with that. And
And the more we talk to people that come with these false diagnoses, essentially of the PNES and things like that, that's the impression I get, that once a physician opens a chart and they see a diagnosis on there, it's really, really hard to prove otherwise,
mm-hmm.
or even get them to want to.
Yeah, yeah, exactly. That's when I went to my neurologist today. She she said, "Oh, you need to go back to your epileptologist. They handle seizures." And I was thinking, well, my epileptologist told me they can't help me. So I guess I just wait for the second opinion doctor.
Yeah, I mean, hope if
Yeah.
anything, you're definitely doing all the right things by establishing this trail, showing that you've been proactive in your care. Obviously, these specialists are not even figuring it out. So at least when the epileptologist sees it, yes, she'll see, or he will see the chart, but hopefully they'll have access to seeing how many other physicians you've already been to, and to no avail.
Mm-hmm. Yeah.
Yeah, that's understandable. So it does take a long time, but I'm proud of you for sticking with it because you know your body best.
Yeah, thank you. I um I have lost a lot in the past few years. Just my function overall. I'm not able to work. I was never really able to work full time, but I used to be able to do a little bit more than what I'm doing now. And now my husband is basically my caretaker. Like even when we went to the doctor today, usually he'll drop me off and he'll go get something to eat while, I'm at the doctor. But I was like asking him, can you go in with me? Because I'm not sure if I can even make it to the elevator. But I was okay. I did go in by myself. But when I
But
went
God knows
in,
you deserve that support. You definitely
yeah,
deserve that resource there just in case.
yeah, just in case. Yeah, he was asking me,
Absolutely.
he's like, are you sure you're gonna be okay? And I said, yeah, I'll be okay. I'll go in. I said, well, I am going into a hospital, so if I need help, then there's plenty of people here. And actually, when I went last time, there was a woman having a seizure outside. And
Oh wow. And you got to witness that on the way in.
yeah,
Oh
that wasn't
boy.
great.
That
And
must have felt like a sign.
yeah, right. And but I don't have those kind of seizures. Now I did have a few when I was a child, but they got them under control really quick.
So you were
But
on medications when you were younger?
oh yeah, yeah.
Oh,
I was
okay.
born with epilepsy. Um,
And they kind of okay, so in your childhood years you had one of those Dravet syndromes or one of those diagnosed, but in your adult life, am I understanding this? Now they're saying it was always PNES or it's changed?
they're saying that now I have PNES. Yeah. Um, when
That's
I
unheard of.
was a child, I had tonic clonics. That's well, my mom said that she noticed that I was like really kind of a drowsy baby, like more than usual. And she kept trying to bring it up to the doctors and they weren't listening to her
And this
until
was before medications.
this was before medication, until I
Okay.
had a grand mal seizure. And then they took me to the hospital, and at the hospital I had another one, and they
Hmm.
diagnosed me with epilepsy. I was 4. And then I had another one, um, and I think they added another medication or something like that, and they got those under control. But then I
Mm-hmm.
started having absence, and she said I had a lot. Like, it's interesting because a lot of people who have childhood epilepsy, like they remember their seizures, but I don't really remember. I guess because they were generalized. Like, I just remember that people always said that I was spacing out all the time. But I had those up until age 14. They took me off the medication because, they don't want you to be on it if you don't have to, because it can be damaging as you're developing as a person.
It's understandable.
Yeah, so they took me off of it because they felt like they had everything under control. So I went all that time uh, with no medication, like into my 30s.
Oh,
And
okay.
uh, it's one of those things, like you have symptoms when they start getting worse, then you kind of look back in retrospect and you're like, oh, was that a seizure? And I just didn't know. I didn't know anything about partial, whatever they called them back then, partial seizures. I
Yeah,
didn't know
focal
anything
or whatever.
about it. Yeah. So every time something would happen, I would just be like, oh, that's just a weird thing that happens. Like, because I remember when I was a child having the like nausea before, I guess maybe it was before absence seizures. I would feel nauseous and I would tell my parents I smell garbage. And
Oh, okay.
yeah, I remember that, but I don't
So you think that
remember.
was your aura in a sense?
Yeah, I think so. Yeah.
Okay.
And I would say, my head is floating away. I was such
Oh,
an
wow.
interesting child to be around, but
I bet.
yeah. So, yeah, it wasn't until I just started looking back on those things when I was having these other sensory symptoms and wondering, are these seizures? And of course, I started looking on the internet, and this has been like 15 years of trying to figure this out.
Yeah. So, and into your
Yeah.
30s without those medications, and then these misdiagnoses, and that's another obstacle to overcome in itself, it sounds like.
Yeah, yeah, trying to get people to look at it. The first neurologist I went to, she said, I think you're having seizures. And she referred me to a specialist. And then I had the EMU stay, and they put me on Keppra, even though the EEG was normal. They said, well, we still can't rule out epilepsy. So we'll
Yeah.
put you on Keppra and see how that works. And actually, I didn't get the Kep rage. I was like cranky with Keppra, but I didn't get rage. But I did okay at first. And then actually when I was looking back at my records, I saw that I actually asked my doctor if I could decrease my medicine, because I'm one of these people that really doesn't like being on medicine.
Is it
And
because of the side effects, or just how you feel like it's really taken a
yeah,
wreaking
because
havoc
I
on your
was on
kidneys?
medication for the
Oh, okay.
first, yeah, the like, yeah, 10 years of my childhood, I was on medication. And
That'll do something to you.
yeah, it did. It caused a lot of like gut problems and things like that I still deal with. So
Mhm.
I didn't really want to be on the medication long term. It was like, okay, can you fix this? And once it's fixed, then I'll be fine. That's not really the way it works. But my doctor actually wrote it in my chart. He's like, yeah, she wants to decrease the medication, and she thinks her diet is helping with the seizures, and I think it was, but it feels like you try something and it works at first, and then it stops working.
Absolutely. Long-term solutions, especially for seizures, are hard to come by, to say the least. The thing about the diet, though, was it a Mediterranean diet or something that has been proven to help with seizures?
It was, I don't even remember, to tell you the truth.
Oh,
I know
okay.
I was doing MCT oil because he put that in there.
Hmm.
Um, and I think I was doing keto at the time, but I didn't stick with keto because it was too hard, but I did stick with the
Mm.
MCT oil for a little bit. And he actually put it in the chart. He was like, "Oh, okay, that's interesting. I'm glad it's working for you." But, you know, then after a while, it's like either it stops working or you forget that it was working and you forget to take it. So I'm not sure which one it was.
Yeah, that's rough to have to circle back around. So there is a post here now of somebody who's just in a frustrated situation. Let's see. Had a seizure, can't drive, moved back with parents, and I can't make anyone happy. Besides chronic illness, I had a random 5-minute grand mal seizure 2.5 months ago. At the same time, I was very sick with things that 3 doctors told me was unrelated. So I moved from my apartment back to my parents as it's a rural area and need to get a ride to go anywhere. There's 0 jobs within walking distance. Can't drive for another 3.5 months because of the seizures. That's how long it'll take to get to 6 months. And I'm on my parents' car insurance to make things cheaper. So when I had a seizure, I was already winding down with my seasonal job. And because of all treatments I needed, I quit. The job I had before was amazing, but I was laid off due to COVID and it's 45 minutes away. I've been job hunting and told my family I was going to drive today. I know, bad, but neurologist ruled my seizure at random and said he highly doubted it would happen again. I went to a job interview and may have scored a job, but I'll need a car because I'd be showing apartments and the apartments are pretty spread out because of the nature of our area. Of course, I came home and my parents flipped, even though I told them I was driving. My mom is angry that I'm low on money, but is mad about me having to drive to get me places. She's pissed that I need help with bills, but she won't drive me to a workplace. And of course, if I have another freak seizure and hit someone while driving, we'll get sued and have zero money. This is not how I imagine my life to go. Every time I take a step forward, it's 2 steps back. Not driving when you live miles anywhere is just, I feel helpless. I've always driven myself everywhere. I'm 25. I feel like none of this is fair. Again, I have bills to pay. I need a job. I'm going insane. I don't know. If anyone who's had seizures or knows how this is, can you help? I'd appreciate it. So frustrated. So, does anybody else feel like they're still in this denial phase?
Oh yeah, me. But I mean, it's kind of hard because my doctors think that it's psychological, so it's hard for me to think that I am disabled. Eh, Yeah, my husband says a lot that I have magical thinking. Like a few months ago, I was like, I'm gonna be a data analyst.
That would sound like a compliment.
Yeah. Yeah, I'm always trying to do something, and he's like, "Really? You're going to be analyzing facts and figures and going into meetings with people?" And
But it's remote, it's working from home.
it is, see?
Exactly. This is where you can come to because we see the logic. I'm right
Yeah.
there too. If the kids would shut up, I could do the telemarketing thing again.
Oh boy, I've done that.
You know,
I'm retired from telemarketing and customer service.
there you go. See, I just couldn't take the credit card numbers anymore when I was collecting medical bills. They
Yeah.
called the
Mm.
company out too much on that. The rep just went silent. Now she has all my personal information and they freaking out over that too many
Oh
times.
wow. Oh no.
Yeah,
That's not good. See, the thing is with my speech, like when I have a seizure, my speech just goes. And there's no way to really mask that, like, or I just start stuttering. So,
exactly. So if anything, that's almost a visual symptom, like you said, something you can't mask.
hmm yeah. But I tutor sometimes
Oh,
2 hours a day or 1 hour a day. So that's the work I'm able to do.
there you go. So the skills
Yeah.
are there. That's amazing because
Yeah.
over time, a lot of people lose even those skills.
I know. Yeah, it's English as a second language, so their expectations are not very high. I speak English, that's it.
Okay,
But
okay.
yeah, the poster, I think, when I was listening to it, that maybe I hate to say it, maybe she's not being realistic about her situation.
Yeah, that is what it sounds like. She already said she's 25, lives in a rural area. When you realize how much of a difference public transportation can make, and it's for that reason, because you can't use it, that's a tough one to get over. But this is definitely like all that energy you're putting into sneaking out to getting a job that you can't keep.
Yeah.
Maybe I would find a better way to phrase that, of use that energy to see what programs are out there. If you can get a ride to some kind of appointment, to, I don't know, talk to family, aunt and uncle, somebody else who lives closer to a city. At
Yeah, I
that point, I
agree.
mean, maybe living at home might just not work. At 25, you're
Yeah.
not helpless, but you're definitely not on your own yet.
The work from
Nowadays.
home too.
Yeah. What do you think, Sia? You think they just sound defeated?
Yeah, I mean, and I can kind of understand that because I'm gonna I'm not in a similar position as like work, but as far as like family life, um, it's been very back and forth between family wanting to be supportive and then the next second they're, you know, telling me it's BS and that I need to get my shit together. Um, and now even with the diagnosis, it's still happening and it's like, okay, yeah, cool. But I mean, I myself have moved past that denial. I know I can't drive. I don't want to risk that ever again. But I still like push myself too hard. Um, like I with yesterday, the whole thing, I had a TC yesterday to trying on new glasses and it was a bad one. I I had like severe chest pain when I woke up because I the muscles in like my chest and my lungs, I don't know what they were doing, but my husband said it sounded like I was like gasping and like air was like escaping and none was going in. Um and then, you know, I get up an hour and a half later and I'm like still pretty out of it from the nasal am. Um and I'm thinking in my head like, yeah, you know what? I'll get up and I'll try to help finish out the night because I feel bad if I don't. And then what ended up happening was that halfway through bedtime, my left leg just started going completely numb and it scared me because I was like, okay, I haven't felt this before. Like normally it's my right leg. I have numbness in my right, but not my left. And with all the weird things happening lately, it worried me. And then that upset everybody. Like, oh, you couldn't finish, you know, bedtime. Now we all have to pitch in and help my husband, my mom, because and you know, you can't do it now. You have to lay down in bed, and we're all tired from work because we have to work to make a living, and that's like the constant thing that's brought up. So it's hard. It's hard when you're living with family. It's hard to like let that denial completely go. Because even if you yourself and even your doctor team know what's going on, it's still hard with family that doesn't understand, doesn't try to understand or learn from what you're going through and be supportive. And with that poster, what she said about her mom, I mean, that is hard. Like she herself, she might be trying to come around to it. Even though it doesn't sound like it, I know, but she might be trying, and then with all of this pushiness from everyone around her, she feels like she has to be doing something else still. And it's the back and forth of like, no, you shouldn't do that, you know, you'll get hurt, and then why aren't you doing that? You know, it's difficult.
Yes. And nobody would ever admit to hypocrisy. That's just too far to
Yep.
ever ask like a mother, a spouse, or somebody like that to admit to being a hypocrite, even if you're, if you're not saying those exact words, all the insinuations and suggestions are there.
Yeah.
You can
And that's
call
where the
it using the
gaslighting comes
facts.
in.
Exactly. It's like using the facts against you, just spinning it in that way. So
Yeah.
yeah, I'm glad we're past that point, but not entirely. Because
I
we're
don't
all
know.
still
I
alive and
wonder
gotta
if it
make
ever
it.
does like go
That
away completely.
that's what I'm thinking. Now we have
Yeah.
this resource, and that's what I'm thrilled about. But we're still trading favors. I mean, I got like 3 hours tonight, and I know nobody's doing dishes for a long time, so it's all
Yeah, I
good.
did a whole bunch of things this morning just so I could have tonight.
Ex and I knew I was expecting that you would do something like that. That's
Yep.
incredible, and you're still recovering.
I
You're
am,
still
but
recovering.
you gotta
Those
keep pushing.
oh, oh, see, you're just more and more amazing every night, every time we
Thank you.
see you.
Oh man.
And I'm saying every night, and over there it's still like middle of the day, isn't it? Your Pacific time,
Yeah.
right?
Yeah, it's 3:39. Kids just went down for a nap.
Ah, beautiful.
Yep.
Love it when that happens.
I know.
So just to raise the spirits a little bit, we've got
5:40 here. What time is it for you?
Oh, Kate, you're cutting out a little bit. Alufa, it's 3:40 here.
Oh, hey, you're
Oh.
Central, right? All right, I'm 6:40 on hotel Wi-Fi, so apologies.
All good.
Now, what we're in this post, they're saying, here we are, Nikki, by having a seizure in front of at least 100 people in the ER's waiting room. I felt so powerful saying, listen, I just had a seizure in your waiting room while I waited 8 hours to talk to you. I need this to stop, and I need you to help make that happen. I finally got some medication, not a daily one, but essentially the emergency inhaler of seizures. So when I have an aura, I can stop them. I also have an appointment with a specialist in less than 2 weeks now to hopefully figure this out. Keep going back to the ER. Keep going to different doctors. Keep pushing. Your health is in your hands and it's fucking exhausting, but it feels so good when somebody finally says, let's see if we can finally find a way to control this instead of, are you sure? There's nothing we can do anyway. I know this isn't the end. I know I will have more seizures, but the fact that someone finally gave enough of a shit about my suffering to push for medications is vindicating as hell. You're worthy of care. You're worthy of being listened to. You aren't making it up, and you deserve to be taken seriously. This girl sounds on cloud nine
Yeah,
to actually
that
get that
is
first referral. Yes,
awesome.
that's reassuring to at least get the rescue med. But on the flip side, Nikki, you said you had a seizure in front of a bunch of people in the ER, no?
No, not in the ER, in the
Oh,
E
oh,
EMU.
you. I'm sorry. Yeah,
Yeah.
that was it. Is EMU emergency medical or something?
The epilepsy monitoring unit.
Oh, and you had a seizure there, and they're still not giving you credit for not PNES.
Because I didn't have a tonic clonic. I had
Oh, just an absence of
the
something.
same things that I have, the, sensations and I guess for most of you it would be like a aura. That's basically what I was having. But I have those in clusters. So I had
Okay,
14 in less than 24 hours. And those were the ones that I pressed the button because I really got tired of pressing the button. And
gotcha.
yeah, so I think those are hard to catch on EEG anyway. But yeah, my doctor said 99% of the time they're able to catch them. So,
Hmm.
It is important, because I heard your story and I just wanted to share too, from my experience dealing with the PNES diagnosis that um it is important to get the second opinion because the first neurologist that I went to and the first few hospitals that I went to, they all told me the same thing. It didn't show up on EEG, so it's not there. And you just have PNES. And they refused to put me on any medications. And it wasn't until I had an abnormal MRI that I finally had an argument with the DO at this hospital that I got life flighted to. And I was like, dude, You are not going to tell me again that this is PNES. You are not going to tell me that this is FND. I had the woman next door to me in my room. She was diagnosed refractory, about to head to Stanford, and even she was arguing my case. And he told me, okay, here's Keppra, and it's the gold standard, and it's probably going to be a placebo effect. Um, and I've been on it for 3.5, almost 4 months now, I think. And I'm even starting to notice the downward spiral, and it, being helpful in controlling my seizures. It is not the only medication that's out there. And in getting my second opinion with another neurologist, he finally told me, I can't believe that you've been misdiagnosed this long, because I've looked over your EEGs and it's clearly evident from what I can see that you have RTLE. Um, and it's so hard for majority of doctors to diagnose because they don't know the signs, they don't know what to look for, and they're looking for one specific thing, and it's hard to find.
They might not
Um,
even be looking in the right side of your brain.
exactly, exactly. So it is so important to get a second opinion, because I'm not doing the greatest on the Keppra, but I have an appointment with him tomorrow. He's gonna change up my meds. I got more tests with him. Feel far more comfortable with him. And he has been spot on with everything that he predicted so far. So
Mm.
it's good.
That's
You
a good
can
sign.
find somebody that can help.
So, Sia, you had tonic-clonics and they said that they were not on the EEG?
Yeah, I was having tonic-clonics and focals on the EEGs, and all of the hospitals that I went to, they all told me that nothing was showing up. And it wasn't until I had an actual neurologist in an office setting as a second opinion finally look over them himself. And I researched him beforehand. He's known for finding things that majority of doctors don't find. And he was able to figure it out from that. And so he's getting more evidence for me on paper by doing more tests. But yeah, it went unnoticed for a very long time. And there are a lot of people I have right side, people with left side parietal lobe. There are a lot of people that have, clear EEGs, and they get misdiagnosed for a long time.
Mm, yeah. I know I hear about it like on Reddit and other forums, but when you go to the doctor, they make it seem like that never happens.
And that's the thing too, they love to gaslight people. They do. And it's all about keeping you in their care, not to have you go anywhere else. But it's not true. 99% is not an accurate representation of what they catch on an EEG. And in truth, it really shouldn't even be the only, thing that they use to diagnose people, because clinical signs are just as important as the EEGs and the MRIs that you get. It all has to be used in combination together.
Yeah, I mean, it makes sense. I did have an MRI too, and I have a white matter lesion on my frontal lobe. But they said that it's so small, there's no way that it can cause the symptoms that I'm having now.
That's even more
So,
reason to get a second opinion for sure, because they told me that my tonsillar ectopia was so small, it hadn't moved very much, that it was unnecessary to look any further into it. Lo and behold, my most recent MRI that I had done with this new neurologist showed that it spread down even further. And his assumption with this is that it's the pressure building up inside of my brain that is causing it to go through the base of my skull and push down the brainstem. So yeah, you definitely need that second opinion. Don't lose hope on it.
Thank you.
And hear this out, Nikki. White matter lesions, everything, you said sometimes associated with seizures, but check this out. They are in particular associated with late onset epilepsy. So if they're trying to say that, everything that was happening as a child is not the same thing anymore, this itty bitty white matter lesion might have something to do with that, because these are proven to
Yeah.
associate late onset, the risk of seizure reoccurrence later in life. That's exactly what white matter lesions do to patients.
Wow. And they
So
would
it
not
sounds
look
like
at
you
it.
have your data. I mean, you have the right to your own data, your own EEGs, and run off with them to somebody else, because they've got to be able to give you a more detailed analysis with some professional.
Don't let them minimize it.
Exactly. Nobody's
Mm.
going to write that off for you. And now I forget where I was going with.
Mhm.
Had another thing pulled up, but that I saw late onset. I'm thinking, whoa, that's you. Okay. Anyway, one of the questions we asked at the beginning was a lot about pregnancy. Have you ever been pregnant? Oh, sorry, Nikki.
Yeah, I have two. They're almost grown now.
Okay.
They're teenagers, 19 and 16.
And this was around the
Yeah.
time when you said your seizures were for the most part controlled.
Is when, yeah, well, I thought they were controlled. It wasn't that bad. If you ask my husband, he'll say it's always been that way. But to me, it wasn't that bad. I felt like I could definitely do a lot more. But when my youngest was a toddler, that's when I started having it was very pronounced episodes that I could not ignore. And that's when it was a few years later, actually, I went to the doctor, because I was like, if I go to the doctor now and I tell them what's happening with me, they're gonna think I'm crazy. So it wasn't until it was like affecting my everyday life that I was like, okay, I better go, because I don't want it to get worse. But yeah, my pregnancies were um, no, I guess normal. I did have some weird things happen when I was pregnant, like um, hallucination sort of stuff, like as I was waking up. But I think a lot of women with epilepsy, they find that their pregnancy, actually, they have less seizures. Was that the case
Yeah, I
with
read
you?
that. Mine were worse. They were more pronounced, but catamenial epilepsy has always been
Yeah.
on my chart, so not surprised there. But yeah, similar to what you said, I was surprised to hear that women, sometimes go into remission.
Mm-hmm. Yeah. And being that I didn't have tonic clonic, so I don't know, I can't speak on that, but yeah, and I wasn't having, but it seemed like after I had my son, and I think I was still nursing him, that's when it came on. So,
Yeah, absolutely. So, in retrospect, anything you would have done differently?
if I knew that I was actively having seizures and I wanted to get pregnant,
Hmm.
that's tough. I guess just like anything else, you want to try to make sure you keep your doctors involved before you start planning to
Right,
have a
right.
child.
To adjust the medications
Yeah,
and
to adjust the
prepare.
medications. Yeah.
That's what it sounded like. A new visitor tonight, her most prevalent concern was considering, she gave the story of being just married and considering starting a family, but she's doing all the planning now and asking the questions. And I'm thinking, I wonder, if I had done something like that, would I have known about Carbatrol and, the medications that I was on, doing anything? Thank God my daughter is, perfect. But uh yeah, didn't do much research with my son either. Happy little quarantine baby, but should have gotten off of one of those benzos before getting pregnant, in retrospect.
Mm. But your seizures increased with your son when you were
Both
pregnant?
pregnancies, yes, and they were actually 10 years apart. My children were 10 years apart, so I'm thinking here, the daughter's been joking around for years that I'm middle aged. You know, as soon as I hit 30, you're in a different part of your life now. You're middle aged, so I don't know if maybe that's sunk in,
Well, if
but
you're
that's
middle
what I'm.
age,
That's
I'm ancient.
that's what I'm saying. So I'm thinking now, son. I'm pregnant with son. I know when to expect the seizures. He comes around. Obviously, I'm stuck breastfeeding, so not going back on any of those medications that I don't want to be. Trying to see the positive side here. I'm on less medications, letting this implant do what it's supposed to do, and actually got to look at my notes, realizing my seizures are not getting any worse. I'm getting off of these stronger medications because I don't want him to be exposed.
Yeah.
And throughout the pregnancy, yeah, I mean, it was kind of a blur at this point. I had more tonic-clonics than normal. It was always on that, third on that trimester. And, when starting the breastfeeding, when it's all the same times as the first pregnancy. But when, once he was already born 2 years after, and now I'm still on a predictable schedule, but taking less medication, I'm convinced now that I probably could have been a little more proactive in that decade in between pregnancies of getting off of some of these other medications that I know do harm to you over time, especially when you're at the max dose. And that's just what the habit of a neurologist is. If you're still having seizures at all, then if you can increase the dose, try it, do it. And I think I had to kind of set him down, get him to look me in the eye and explain that's not my game plan anymore. Now I have this RNS device. You have all the data that you need to analyze what's going on. I've only had this device active for 3 years now. And before I took myself off of the medication, I don't think they were doing much. I don't think they were really changing the settings much. I don't know if they're trying to save battery in this thing or what, but I had to get serious with the doctors about, I want this to be my primary treatment for seizures rather than medications, because the side effects and long-term effects on internal organs, I don't think are acceptable.
Yeah. They took me off at the time. I was on I don't know what it's called now. Is it called it was called Zerontin. I think it has a different name now.
I'll look it up.
I was on Zerontin and Tegretol, and that's when they took me off of those when I was a teenager, because I was having like stomach aches, and they said that my liver, I was getting liver damage. So I'm glad that they did discontinue it. I wish I had known more about epilepsy. It really felt kind of like a mystery to me,
Yeah.
because I didn't know what was going on. I
Just take this medication and hope for the best.
Yeah, right. I just knew that people were like, "Oh, are you okay?" I knew I couldn't like swim, I couldn't ride a bike, I couldn't get on roller coasters, you know, and like I was even in special education because I had difficulty because I was having so many absent seizures. I was in special education all the way up until 6th grade.
But that's impressive. Middle school, I mean, elementary school, you know better than anybody, being that you're, an English tutor. That's the most important years of getting the basics down.
Yeah,
So
yeah.
if
I
you
mean,
made it
I'm
out of
grateful
special
that,
education, that's
yeah,
like
right.
jump into advanced. To me, that's what that sounds like, going from basic to advanced. If you made it into middle school, that's when the algebra starts.
Yeah, it was shocking. I remember telling my mom, I'm like, I want to be in a regular class, because the kids would make fun of you. They would see the special education class that had like 6 or 7 kids and at lunch, and they would kind of make fun of you. But I struggled. I struggled in school, and then finally I just was like, I got to get out of here. And I homeschooled the last few years of school because I was just overstimulated all the time. It was just too much for me. But
I did too.
Yeah.
I went to a special, I call it the special school for special kids, um, for mental health reasons. And then I was basically dropped out of high school because it was just too much.
Yeah. Yeah. I think we talked about that before, the neurodivergence. I think that was the reason why I had a hard time in school. But
Yeah, I feel the same way with my ADHD and my autism. I had a really hard time focusing, learning properly, and they don't cater to kids who need more. Um, and I was never allowed to be put into any other classes. My parents ignored it. So I finished high school with a 2.3 GPA, I think. Is really low.
you finished though.
I did,
You
thankfully,
did
at least.
finish. Yeah.
Yes.
That's a victory.
There you
Yes.
go. That's exactly what you bring up
Because I
first. You
know
did
how
it.
stressful that is. I was like going to 10th grade and I was like, I can't do it. I think I did. I was like at the beginning of 10th grade and I was like, I can't do it.
Yeah,
Cannot
it's
stay
so
another
hard.
day here.
I wanted so badly to go into homeschool because I felt like it would have been so much easier to learn at my own pace, but
Hmm.
I wasn't given the option, so I pushed through. But yeah, if I could do that over again, I'd do it differently.
Oh yeah. So Lufa, when you were in school, you said you were in the special classes, and did you actually finish high school?
No.
Is
Not,
that a goal of yours?
uh, eventually, yeah.
Okay. So has your learning style, like, do you still read? Do you kind of know how you're going to tackle that?
Um, I don't know. I haven't really thought about it yet.
That's cool. I was just so surprised at figuring out how little reading daughter's even going to have to do to graduate. If it wasn't for like starting college classes, then a lot of surprisingly online learning she can still watch videos of essentially. So
Yeah,
there's a lot of different ways to learn now.
yeah. Hopefully it won't be, something won't be that bad, but
So another post here, somebody saying my partner is understanding, but he doesn't understand. He'll listen to me cry about my TLE symptoms for days, and although he's extremely sympathetic, he just doesn't quite get it. He explains things away and feels that my symptoms, memory loss, and mood swings are relatable human experiences. I know that everyone occasionally he lapses in memory and or has lapses in memory and mood swings, but I also see the patterns and correlations between my seizures and side effects. I want to be able to vent about these things and have to them to be dismissed as something common. Curious about how other people deal with them and if it's ever going to get better. I feel like a broken record with him, and I'm sick of being told that my experience is not any different than anyone else's because I know that it is. Sick of feeling alone.
I will say that I have experienced this with my husband, um, and with other family members as well, is that when I try to talk about my symptoms, um, it's usually minimized. And like just recently, the biggest one for me was that one day, deep in an aura with a headache, um, I was telling him that I felt really strange and that I thought it was weird that I had memories flooding back into me that I didn't feel like I knew about. And he was like, "Oh, that happens to everyone all the time." And then I was like, "Well, I don't remember my childhood." And he was like, "Well, nobody remembers their childhood." And I was just like, "Okay, well, that's not what I'm trying to get across, but it's difficult to explain it to people who don't understand." And that's why I like being here because it's nice to be able to talk about the things that we're experiencing and ask questions and stuff and actually get, supportive answers and advice and support in general. Whereas with family members who, have, I guess, their own things to deal with most of the time, they don't they don't have as much space to give to you to be able to talk about what you're feeling and how it can be shitty most of the time.
Yeah, I was wondering, do you think that sometimes people, well, two things. Maybe they think that you are going to think yourself into a seizure. So they're like trying to minimize it, like, oh, don't make a big deal out of it because then you might have a seizure.
Oh, I totally feel like that. And it's even directly said to me sometimes too, like, oh, I'm so sorry for stressing you out, and oh, I didn't want to bring this up to you, or we don't need to talk about that because that's too much. And it's like I think I can tell for myself what's too much for me, and I don't need everybody to be, fearful of causing a seizure because that's not, I mean, one of my triggers is not stress. I know it is for some people, but for me personally, it's just not. And so, it's kind of hard to hear that because I'm like, okay, then I guess you haven't been listening to me because I have already told you this multiple times. It's not something for me.
Yeah. So what are your triggers?
Personally, so far, from what I've noticed, is THC is a trigger for me. It's also a trigger for my endometriosis. It causes flare-ups, so it makes me very ill. High altitude, or just in general, honestly, moving altitude from going high up to super low. I have to travel to go see my neurologist, so that drive down, and the car sickness, like the vertigo that I get from being in the car, is a trigger for me. Too much sugar, like if I have too much sweets or like soda or something like that, that can make me have a seizure. Um, a lot of it has to do with my equilibrium though. So like yesterday with the new glasses, it's like, for people with glasses, there's always a transition period,
Mm,
changing between the lenses. But um I guess now for me it's like too much for my brain to handle, so it just like spiraled me out of control very quickly. But what are your triggers?
it's similar. I do get the altitude thing, and also the worst is the storms. If there's a storm that's like out, miles from us, and like the storm is gonna come later on that evening, I'm just in bad shape. Like I can't even hardly talk.
You can feel the pressure changing.
I can feel it. Yeah, it's like someone
Yeah.
is pressing on my head. Also, this is a weird thing. I used to wear my hair up, but that would trigger seizures. Just
Ah,
that pressure on my scalp. So I wound up cutting my hair because I'm like, I can't put my hair up.
because
And
it
my
causes too
hair,
much
yeah,
pressure.
yeah. So
Yeah.
I was like, I'm just gonna cut it so it can always be predictable, and that way I'll know what to do with it.
That's
But
why I
yeah.
like to stick with the braids. It doesn't pull as much.
Yeah.
And as far as I'm concerned, that's the signature look now. I love it.
Yep,
This is my
every
signature.
time.
Yeah.
Absolutely.
Yeah, I like those. Yeah. Even
Thank
even
you.
braids sometimes at night if I try to braid my hair, so it'll look presentable the next day. I have to be careful not to get too close to my scalp.
Yeah, you gotta leave a little bit of room and
Yeah.
like keep it loose.
I am really
So, Nikki, that
sensitive to
sensitivity
pressure.
to pressure, what about hairnets or hats or any accessories?
Yeah, the same thing hats. I have to be careful. I'll
Oh,
start getting like dizzy and nauseous, and I'm like, what happened to my head? I don't know. But
okay.
it's
So doing
really,
any,
really sensitive.
handstands or toe touches and stuff like that is really pushing it.
No, yeah. Can't do any of that. Now it's funny because they had me like in kid gymnastics when I was younger. I could do that, but as I get older, I get more and more sensitive.
Sensitive. Yeah.
Yeah.
Well, on that note, this is one I've been saving for ladies' sex. So, Lufa, get ready to contribute. This one starts off as so, female. I've been on Lamictal for a few months now, and literally since about a week into it, my orgasms changed. Basically, they last for a long time and don't stop until I stop whatever it is I'm doing. There's a build up and then you hit peak. Usually it just sort of peaks and then goes out in waves. Then it's done. This way, I hit the peak and the waves go out and just don't stop. It's like waiting for the beat to drop. It just never does until my hands get tired. If I'm using a toy, I'll literally go until the battery dies. Is this normal? Seems kind of freaky. Really not that I'm complaining. Also, way more horny than I've ever been. Anybody else have a perspective on that?
Why
Lamictal.
That
She's talking
typically
Lamictal.
safe for me to contribute to this?
Come on, you're like the only young single one around here. Oh shit, I'm single now. Okay. Go ahead.
I don't do all that. I'm just like, I kind of just sit back and relax and watch true crime stuff and whatnot. I don't
And when
know.
those doctors solve a cold, I mean those detectives solve a cold case, that's exciting. Come on, talk to me. Any medications ever affected
I mean, they make me
unexpected?
not
So it does the opposite for you. You're saying it
excited.
kills the libido. Okay.
I don't get that long. Like, I don't know what. I don't really.
That sounds like it could be inconvenient at times.
I mean, my best advice would just be to not do it if it's causing a problem. But if it's not causing a problem, do your thing. I'm not judging you.
There we go.
Judgment free. Do your
There
thing.
you go.
It could be like a medication thing, maybe like heightening
She
it
did mention
versus
2 weeks into Lamictal.
yeah, that I've gotten a message DM one time on Reddit from somebody asking me it if the Kepra ever raised my libido, and it was a little weird because I'd never spoken to this person before, but I was just like, I haven't experienced that, but if you are, then I would talk to your doctor. But yeah, I mean, I think that can be a thing. It's different for each person. It affects everybody differently. So it could be what's going on here, but then again, I've never experienced that. Although I have experienced seizures during and after. So yeah.
Well, I mean, what effect did that have? Like for me, if I had a seizure like during or after, all memory would be gone.
Yeah, I mean, that's usually how it is. Like, the 5 minutes in, and I'm like starting to lose it. And then he's like, oh shit. And then everything stops, and I have to lay down. And then I'm out for the count for a while. And then he wakes up and he's like, are you good? I don't know if I ever want to do that again.
How do you hold back from just telling him, I got to do all the cleanup and I didn't even get I don't remember.
Yeah, like
That's a little one-sided there, but
it is.
always got to understand from their perspective too.
Well, and he's been through a lot. He had to go 6 months one time. So, yeah, I try to respect his opinion.
That's the best way to look at it. So you get like wife of the year at this point. What do you think about
Yep.
that, Nikki?
I don't know what to say about that. I don't have any expertise on what the poster um, was saying. I think, definitely having any kind of disability is going to affect your entire life. So I think that, yeah, I don't have anything to say about it. I don't know.
Honestly, I started taking notes for this visit a long time ago, and I think what triggered that was because, or what prompted me to write this one down is because this was when I was 2 weeks, July 6th, off the clobazam entirely, and I didn't expect changes like this. Okay, but this was an increase, the opposite. Everything I've always heard is like, a decrease. You don't want it anymore. I'm 8 months out of this relationship, and yeah, I had bad thoughts sometimes where like, am I ever actually just gonna forget what it is? Because it's going on a long time now. And this week, like, it looks like I wrote down that I came really close to asking a friend for, a favor essentially, because I was just so stressing about how I might just, forget what sex is entirely, what it feels like and whatever. But I think there is a lot of downplay on how getting off of the medications actually, going on a new treatment plan, especially if your doctors don't necessarily order it, might affect your mental health and well-being. Lord knows I don't do that kind of thing. I don't even know how to find porn if I wanted to, but I came close to asking a friend for something, and that's not that's way out of character for me. I was just so scared, I guess, of these different feelings going on now that I'm off of the medication. It's not what I expected. When unexpected things happen because of these medications and these treatments, you can definitely do some unexpected things. Anybody else relate?
I'm wondering if that could be a seizure in itself.
It did feel anxiety, but why would I be wet when I'm thinking it? That doesn't.
Well, it's kind of like there was a question yesterday that we talked about on Family Day. I don't know if you were there for it, but Poogie asked
I was in
about
and out.
it was a guy talking about how he was thinking that the masturbation that he was doing had something to do with the amount of seizures that he was having, or if they were causing the seizures to happen because he was doing it, or if he was having a seizure and doing it in the seizure, which was a confusing one, and we didn't get very many answers out of it. But I mean, there's so much stuff out there with the medications that we still don't understand. So there are things like that that can pop up that are kind of scary, like you were saying. Like, it's scary that you went so far to do that. But it's like stuff, all of this is out of our control. We're guinea pigs in testing right now, and all these medications are things that they don't tell us all the details about. And then even with the seizures, like you don't know what's happening inside of there. You can't see it. So, new things could start happening out of nowhere. Like for me, for example, I had a laugh attack seizure, and I've never had that before. And that was like really weird. And my husband was laughing his ass off when it happened because he was like, "Why is she laughing so hard?" And I was dying, like literally could not breathe. And he was like so confused. He was trying to keep straight face, but watching someone laugh hysterically so loud and disturbing like that is definitely strange. So there can be some strange seizures.
Thank
Yeah,
you.
there can. The way I think about it is like the brain, anything that, any action that we take, the brain is controlling it, like actions, feelings, sensations. And if the seizure can occur in that part of the brain, then it can create that kind of behavior. Like years ago, my mom had a friend who had seizures that made her kiss people like on their arm. So I think it was a kind of complex partial seizure because she wasn't aware of it. But she would kiss people up and down their arm. And of course she got in trouble a lot with this kind of behavior, but just any behavior that you can think of, a seizure can cause it if it occurs in that part of the brain.
So if
Yeah, that
anything,
makes a lot of
that's an
sense.
important thing to pay attention to.
Yeah, it is. And that's why it's good to take notes about anything that you feel is off. Because we know ourselves the best, and we know when we're not feeling like our normal selves. And so anything out of character for us is good enough to write down and keep track of.
And in combination, there's the memory loss there too. So I don't truly know myself 10 years ago. I couldn't tell you what my day to day was before, you know, before a second, before it's sun, really. I don't really remember what I was doing going to school and working and with a 3-year-old. He had the CDL, so he was out of the, gone all the time. I had a camera, but nobody lived with us.
Hmm.
And that went on for a good 7 years. So I don't remember how or why. Like, we were in DC. How the hell did I not get shot? I don't know. But here's a funny one. Nurse yelled at my husband. Hi guys, buckle up. We had this one nurse at our hospital that has been rude to us since we moved here. She said many times that I am too young to have had a heart attack, along with a bunch of other BS. Anyway, that's not the point. My husband is my biggest supporter, caretaker, best friend. He does everything for me. We went to the ER a couple days ago because I had a seizure and hit my head. It's important to note that I already had a concussion due to this exact thing happening a few days ago. It's important to note that my husband is a bomb tech and was on emergency response all day, dealing with people being dumbasses, and wasn't able to pick up a refill of my seizure meds. I still had some, so it wasn't a big deal at all. At the ER, I wasn't coherent at all, and to be honest, my memory is a little spotty, but I remember being at remember the basis and then his retelling. So we're there, and I'm loopy. I go in for a CT scan, and we're excited because we haven't seen her. But I come back to the room, and she walks in. She doesn't say hi or anything to us, but that's fine. Instead, she turns to my husband and starts literally screaming that it's his fault I'm here at the ER, and that it would have picked up if he would have picked up my prescription, I would have been completely fine. He tries to explain the situation while reiterating that we have extra Keppra, but she starts yelling again, saying if he would care, we wouldn't be there. Then she makes him call his chain of command. He's in the army, so it's like 1 a.m. at this point, in front of her, and tells him to tell them that he needs to pick up the prescription tomorrow. They know us very well and we're all friendly, thank God. But they were like, if you're on call, our hands are tied, but my wife can pick it up for her and bring it over if that's the case. This answer didn't appease her, and she tells Thor, I'm guessing her husband's name is Thor, that he has to go tomorrow, and if he doesn't, she's going to report him for some caretaking thing. We did end up getting the prescription the next day, but he was so upset and felt awful about himself, even though he didn't do anything wrong. Could you
Oh
imagine a
my
medical professional calling out
gosh.
a spouse in the army? You have to call chain of command in front of me. Where in the world did this happen?
What kind of power trip was she on?
Yeah, that nurse must have been mouse. I just said that
It
nurse must have
sounds
been
like
like
she was having
pinning
a bad
something.
day.
Oh yeah.
It sounds like that was her personal stuff that was coming out.
Yeah, that can
Yeah.
happen sometimes.
Especially when the circumstances are there to make it look like, patient probably mentioned, oh, I didn't get my prescription today, or maybe patient didn't mention it at all, and nurse just happened to notice on the chart on an army base. I'm thinking maybe all the paper, all the medical data is together, so maybe nurse could have seen that she was due for a prescription pickup, didn't happen, and maybe that was her just kind of putting two and two together before necessarily asking the patient about it. So yeah, I'm thinking she probably jumped the gun on that one, but I can understand why that might get frustrating if you think you see a situation that could have been prevented?
That is super inappropriate to do as a professional. That is so inappropriate. Like that's just inappropriate. So I don't know.
Yeah, I mean, especially somebody in the army, you can't really do much. You're at the will of the government at that point.
You know, telling them to call chain of command in front of her, that's the part where I thought it crossed the line.
Yeah, and if he's in the army, I'm guessing that they live near a military base. And so maybe her husband is also in the army. I mean, she was mad at him.
That's true.
Could
That's
be.
true. Must have felt like a familiar situation.
Uh-huh.
Mm,
There is a lot of stuff like that too within the army with husbands and wives and marital issues, couple issues.
Oh yeah, yeah. I live
I'm
around all of
sure
it.
she could, yeah,
oh
I'm sure
yeah, you
she
know
could
any CDL
probably see
drivers?
some stuff.
Yeah. We live near a base, and yeah, that's true. A lot of family problems around
Yeah.
here.
Shame. But all in honor. This person is saying they're writing something about post seizure pain. Sounds like they want some answers. I had a seizure in my sleep the other night slash morning. I woke up completely disoriented with no sense of what day it was and some temporary amnesia. In the ER, they referred me to get an MRI done, which trying to schedule has been a nightmare for the last few days, and sent me home feeling like absolute garbage, and that has only gotten worse. My lower back is killing me. I managed to get some muscle relaxers from my primary doctor, but those haven't seemed to help much. I could barely get out of bed this morning, stiff, but with sharp pain if I turn or bend any sort of way. Is there anyone who has experienced this that might be able to suggest something useful? I've tried heat pad, biofreeze, Tylenol combination these past 3 days, and it's just not cutting it. So lower back is killing me is what this one was she saying.
I have injured my, what is the bone on uh the lowest part of your back, like right on your butt?
Toxic?
The
Mm.
Yeah, I've injured that from a seizure and it hurt for like 2 weeks straight. And nothing was helping. And I probably should have gone to the doctor, but I just, the brain. But yeah, I mean that could be an injury that happened. And they might not have realized it at the time. But I would definitely suggest getting like a second opinion to check that out because if nothing is helping it, and it's that uncomfortable, then yeah, you got to get a second opinion. Also, I'll be right back.
Yeah, that makes sense. So some of these seizure injuries really do. If I can't see that something is like, not like a compound fracture or bleeding too much, then I'm more likely to just try to fix it at home. And sometimes it takes some weeks, unexpected. How do you handle your worst soreness and injuries, Lufa? Warm bath and heat pads or anything not typical?
How do you handle your what?
Your worst injuries. You know how like the being sore after a seizure is a totally different kind of sore? Do you
Uh,
have any suggestions for maybe other
sleep
people?
and darkness. So during sleep darkness, I hate being in the ER. That is the worst place to recover from a seizure.
Just all the commotion and light.
Mm-hmm.
Yeah, that makes sense. So did anybody come with questions today or something you wanted to bring up to other ladies?
Yeah, I guess I was wondering, does anyone else have a catamenial like pattern with their seizures? Is it worse before your period or ovulation?
Go ahead, Lufa. Didn't you say you were catamenial too, Lufa?
Yeah, I don't know. I would assume so, but I don't know. I have no idea.
On mine, the health app on the Apple phone, I keep the meds and the cycle on there, and it's this useful reminder that it tells me 3 days before the cycle starts that be advised it might happen within the next few days. That's typically when the seizure happens,
Mm.
Yeah.
and then record the data as it goes. It just asks for if it's on, and then heavy, light, or medium, and upon the last day, usually when symptoms stop, for some reason I wasn't putting two and two together for a long time until I started actually writing the stuff down. Before iPhones were a thing, it did take writing it down on a calendar, circling days in different colors to
Yeah.
tell that these things did actually happen on the same day or within 24 hours. And that's what it took for me, because when puberty started for me, it was never regular, never predictable. But I was a lot more active. I probably didn't drink enough, and I always just listened to the doctor's advice of live healthier and you'll be regular, or maybe it will stop for a little bit, and that doesn't mean
Mm.
there's anything wrong with you. The doctor never associated irregular menstrual cycles as a cause of concern at all.
Wow.
Yeah,
Hmm. That's concerning that they didn't even think it was a concern. Yeah.
that was going on for a couple years before the first seizure.
Wow. Yeah, I'm sure that probably contributed to it in some way. Like,
I think it might have had something to do with going
yeah.
to that real strict little Catholic girls' school up in New Jersey here too.
Uh-oh.
Yeah, it's a little bit of a taboo. Don't talk to me about that kind of thing. And parents had to both work full time a lot. The cost of living up here has always been ridiculous.
Oh
Glad
yeah.
this is a vacation.
Yeah, yeah. I we might want to move there one day.
Oh
But
yeah, you took a look up here in the tri-state area.
yeah, I was raised in, I mean, I'm from New York, but yeah,
Oh, we
I'd
could see
like
New
to.
York from here. We're over in Wayne now.
Oh, okay. I know where that is. Yeah.
Yep, yep.
That's
Oh,
not
I
far.
see I see what the tax dollars are paid for.
We want to move to Hewitt, the Green Lake area. It's so
Yes.
beautiful.
Oh,
Yeah,
it is
that's not
gorgeous
far
out
from
there.
where you are.
But I noticed it's 1,000 square feet for $4,000 a month rent.
Yes, it's crazy. It's insane. Right
Yeah.
now it's just a dream.
Oh yeah,
It's a
that's
very
what I wrote it
elaborate
off as.
dream.
Yeah, I don't know if you noticed the chat in EU on Reddit. People are throwing out there a lot of ideas to, maybe plan an event, some kind of get together in 26. And I just put it out there to let's talk location. The priority for a lot of people is, choose a state that is, where THC is 100% legal. And New Jersey is one of those states. Somebody who lives in Philadelphia suggested New Jersey as one of them, and there was an overwhelming response of nobody likes New Jersey. Don't get your head out of the clouds.
You know
I
what, though? When growing up in New York, I did not like New Jersey because the only thing I knew about New Jersey was Newark and like
Patterson,
T-Neck and places
Trenton,
like that.
yes,
Yeah.
yes.
It wasn't until the past few years we were visiting Jersey because my dad is from Jersey and he's in the VA hospital. He's dying, but we go and see him, and when we go see him, we stay in Hewitt. So that made me
That is a
see a
getaway to look
different
forward
part of
to.
New Jersey.
Oh yeah, different
Yeah.
world. So you see the tax dollars at work. How I was talking about it, just like better roads. There's a
Yeah,
public
I know.
park on every corner, and
As
they
soon
are
as
nice.
you drive over to the New York side, the roads get worse.
Literally on the bridge, you feel like it starts sweating. Yes,
Yeah.
yes.
And you know how New Yorkers and New Jerseyers are. Like they don't
Oh, always, always.
they have their beef with each other, but
Oh yeah, fucking Jersey and hate New York. Yeah.
yep. But now I kind of see it. I'm like, wow, I can get the same food in New Jersey, and it's better roads, and it's prettier. But
Oh,
there's parts of New York that are really nice too.
but my mother will not leave until we go to a diner. We have to take our entire family to a diner,
Yeah.
and little buddy's not always the best at restaurants, but she is convinced that
Wow.
something about a genuine Jersey diner will settle him down.
Wow.
We'll see. Lupa, what were
We
you saying
got
about the
bagels the last time we were there.
yeah,
Not the
there's some good bagel spots. Not Starbucks, that's for sure. Yeah, Lupa, you started saying something when we were talking about possible location for a meetup event thing.
Oh, I just like New Jersey.
Oh, there you go. As
Good
long as
bake,
the good memories are there.
good pastries,
There you go.
good pasta, good food.
Mm-hmm. Yeah. And I can't eat
I
the
don't.
regular stuff. I have to eat gluten free, but they even have that.
Yeah, and I don't want to. I don't want to go anywhere hot because that makes me.
Does that trigger like dehydration, or it's just heat in general, even if you know you're drinking enough?
It. I've just always been like, I don't know, like I get triggered by the. I don't know, the heat just totally wipes me out.
Me too.
And with like the
Mhm.
sun totally wipes me out. I get sun poisoning a lot, or like, uh, yeah, I get sun poisoning, like sick.
That's what I was surprised about up here. I mean, it feels better in the morning for sure. When the sun comes up in Florida, you can't. I don't want to go outside after 5 minutes. But
Mhm.
up here, it was 7:30, and I took the dog for a walk with a hoodie on, and didn't have to shower when I came back.
I'm so jealous.
That's incredible. That is incredible, and it's a big difference in the feeling and not that big of a difference in elevation. I really thought we were going to be like in the mountains up here, but it's only 600. It's only 600 feet elevation.
Really?
And the Smoky Mountains, when we were at 1,500 feet,
Oh wow, yeah, yeah.
that brought it on.
That
It's
brought it
like,
on. Yeah, now I did
I,
have a hard
yeah,
time when I was there. We were there last month, and my ears that's the military base. My ears were popping
okay.
um, when we were there the last time. But I
Hmm.
did pretty well with seizures because I thought I figured out the cause of my seizures because I have so many allergies. So I started taking an antihistamine, and I did pretty well that week that we were there. But then when I got back, I got worse. And I was like, what is going on? Then I figured out, oh, it's the antihistamine. It lowers the seizure threshold.
Oh, okay. And that's one of those little side effects they don't mention.
Yeah. So now I can't. It's one of those catch-22s. It's like the allergies are probably exacerbating the seizures. So you take an
Hmm.
antihistamine, but the antihistamine also does that.
Yeah. So talk another risk versus reward
Uh-huh.
that
Yeah.
they failed to mention.
Yeah. No,
I was. Mhm.
I started taking that on my own, and I like added a bunch of supplements. I'm still taking the supplements, but I stopped taking the antihistamine. But that
So
was a
in
great
stopping to
week.
take the antihistamine, was that one of those? I mean, do antihistamines form that kind of dependence where if you stop at cold turkey, or did you have to clean off of it?
No, I don't think that one does. It's
Okay, okay.
like cetirizine, or I guess that would be what is it called? Zyrtec.
Oh, okay. Yeah,
I
I've
don't
heard of
think
that
it
one
does.
before.
Yeah, it was a very low dose, but it really helped a lot. I mean, I think that's why I was feeling so good. Not only was I not having hardly any seizures, but I also had really my energy was higher, which,
That's the part I like better.
yeah, I'm always just so tired and lethargic, and I'm like a sloth, a human sloth, pretty
And that's the
much. Yeah.
thing with how your memory is, sometimes if that's the new you essentially, you don't notice until it's different. Did that ever
Mm-hmm.
happen with you, Lufa, where they changed your meds or switched you off of one onto another, and for that little break in between, when you were off of one and not, up dosed on the second one, that you actually felt better, more energy or anything? That's how I remember it, coming off of one of the Ficompas or the Briviac, like one of those benzos that really had me feeling bad. I
Well,
forgot.
when I was on like medication for, because I've always been on like a lot of antidepressants and anti-anxiety or antipsychotics. Um, all those little fun guys. Uh, I am naturally have bipolar 1, so I'm up and down. And most of those meds like just didn't work for me at all. So I never really got to experience them. And I've always just been bipolar.
Did they always just have you on that low dose, that lowest dose? You didn't notice an improvement, so they stopped you?
They just kept trying different medications over and over again.
Oh, okay. Well, at
Uh,
least that's a little more reassuring. I'm happy they didn't tell you take more, take more, take more
I
until you're
mean
at
they
the
did,
max dose, and then, oh, okay. Yeah,
they
that's
did.
that cycle.
But they would also, I've also been on like probably over 100 different medications. But they kept me on one of them that gave me a really bad side effect for 4 years. I don't know why. But right now, the Breviact makes me really tired. And I heard that can be a side effect. So I'm on a stimulant and it makes me tired. But I'm also anemic, so
Yeah, that's definitely a hard cycle to get through. So in taking your notes though, does your doctor actually, you feel like they're on the same page with you? Because you probably have a couple different specialists, right?
no, I just have my psychiatrist, my
Oh, okay.
therapist, and my uh seizure specialist.
And they're
Uh,
just saying, even if this med, you don't feel as happy or active, it's still controlling better.
the Breviac is not controlling the seizures as much, but
Is that one for
I
absence
mean,
seizures?
what?
And is that one of those ones they give you for partials? The focal seizures?
They give it to me for the generalized
Oh, okay.
seizures because when I was in the when I was in the hospital, I asked him like where in my brain is the seizures, and he's like your entire brain, and I was like, oh, lol, that's funny. So sorry. So hi mom. So wait, what were we talking about?
Weaning off of, you said you were having the seizures because the Briviact wasn't controlling your generalized seizures.
Oh yeah, the Briviac is for to control my generalized seizures. Um, the Capra's still coming down. The reach is still there. Tony, you get fed. Um, it is still coming down. I still have Capra rage every now and then, but I'm able to control it. The depression is still there for sure. But the Briviac just makes me like tired. I feel like it doesn't really work as long. I'm on a low dose, but it makes me like really tired. So, I don't know.
Do any of the medical professionals say, we'll try this one more dose and then make a change? That's what I
Well,
used to appreciate when the
supposed to
doctors would
be
kind of tell me a plan.
my neurologist seizure specialist who are gonna go down. He's in Chicago. So we're gonna go down there.
Oh, okay. So is this one like an epileptologist?
Yeah, he's at the university. I have a really good care team. So
Nice.
I think they'll take it seriously. I want to see if I can get a MRI or like I don't know, like a scan of my brain.
To get like an actual picture to look.
Just wow. Okay, sorry, my cat is hungry.
Kitty's still in the show.
Yeah, he's hungry. He's to eat. I want to get a MRI or something of my brain just so that we can see what it looks like, because I don't think we've done that, and I think it would be beneficial in my opinion. Yeah. Even though my brain is still developing.
Yeah,
I
that's true.
know that. I admit that. But it doesn't hurt to take a look.
I'm surprised they haven't taken an image. That is surprising. Yeah. Well, hopefully that'll result in something.
They
This
might.
person has a question too. What do you say?
I don't know. I don't think they have.
Yeah, no, at this point the MRI is not an option for me anymore. Once you get the implant, you can't go in that big magnet or else I guess it'll like rip it out of my head. But they're trying to say that there was plenty of pictures taken before. So that was enough to know there's nothing there. We'll see. Time will tell. This person has a question saying, why do I only have seizures around other people? This is by no means a complaint. Having a grand mal seizure all alone sounds like a nightmare. But I find it curious that having suffered from seizures, focal, tonic, and occasional tonic-clonic for 10 years now, I've never had a tonic or tonic-clonic seizure alone. There always been a person with me, thank God. I've had many focal and absent seizures alone, but not a full-blown knocked unconscious experience. For reference, I've probably had 40 to 50 tonic seizures in the past decade. Could this simply mean people are a trigger for me? I love people and I love being around others, but I also have autism. Social communicative interactions can be difficult, to say the least. So it could make sense. Does anyone else have or relate to this experience? Well, sounds like they just discovered their own, a trigger.
Yeah. Being overstimulated by people. That makes sense.
Yeah, because what they're saying too about having a tonic seizure, but not tonic-clonic. Tonic seizures can still, you still get injuries. I think tonic is the part, where you lock up, you get all like tense essentially.
Yeah.
So you can't stay standing during a tonic, from what I understand. But yeah, I would want to know if it's always in the same place. If you have some kind of routine, and right when you stop at that corner store is where those seizures have happened. It could be anything. If they're happening in the same place, a scent, or I know the gas stations sometimes smell really strong to me, and I might get dizzy before I realize it.
Yeah, I don't like that smell either.
Yeah.
Yeah. I think
So that could be
you
it.
hit it right on the head. They discovered their trigger.
Exactly what it sounds like. Now,
Recently, all I can taste is like metal in my mouth.
For how long?
It's been like 2 weeks.
Wow.
and it hasn't gotten
Yeah.
rinsed away or washed away, or like even after brushing your teeth, you don't just taste the Listerine or something?
It still tastes like metal. It tastes like metallic-y.
Ooh.
Yeah, you definitely want to talk to your doctor about that
I
because
don't know.
that can
I
be
don't
an
know
aura.
what that is though. That just came on suddenly, so I don't know what that is.
Yeah, mention it to your doctor. I get the metal
Absolutely.
taste too, but like I was saying earlier with the storms, like that's part of the symptoms I get is I get a metal taste and I have problems with speaking and I get all the other things. But a metallic taste can be like an aura or it could be something else. But yeah, it's definitely that's a long time to have a metallic taste.
Yeah, I don't know. It just kind of always tastes metallic-y.
Yeah, like you have a penny in your mouth.
Yeah, and
Yeah.
I eat, but like at the core of everything is like that metallic-y weird taste, and I'm like,
hmm Now you did say you're anemic too,
yeah,
so it could also
rec-
be that. Yeah.
yeah. Recently, my anemia has been really bad. I've been like feeling really weak. I'm getting a lot of bruises.
hmm Oh wow. Yeah, I'm anemic too. I can't seem to get out of being anemic.
Yeah, that's no fun. And I
No.
don't really know what to like do about it because it's just
Well, it sounds like it might just be a blood test, iron deficiency.
hmm
Is
I mean,
that the source of your anemia?
it's always up and down.
So you
All
just don't feel
the
like
time.
it's bothering you enough yet? Well, at least you know what to ask for. Letting them know exactly what's wrong, what you got, and hopefully they do what you
Yeah.
expect. This one now sounds frustrating. Somebody saying medication withheld by a neuro. I had a 72-hour EEG back in April 24. I was absolutely miserable the whole time, ended up with scarring on my forehead from the nodes, and my insurance covered nothing. They adjusted the bill by 20,000, but I still had to pay 3. The best part is they didn't even find anything. I have been nervous to schedule a second long EEG due to these reasons. My neurologist has been calling to try and schedule a second one. I was about to run out of medication, and the neuro declined my pharmacy's refill request. So I called the office to try and get a telehealth appointment to get the prescription. Live in a rural town, office is over an hour away. I was told they would prescribe me enough to get to my 72-hour EEG and made me schedule the test. Around an hour later, I got a call from my neurologist who is now claiming they will not continue to prescribe me my medication if I don't complete the study. Does anyone else have a neurologist that requires yearly 72-hour EEGs? I can't help but feel like I'm being forced to complete this highly expensive study that will probably not show anything just so they can bill me. That just screams that's the business to me. That's how it works.
I didn't know that there's a required. I did not know that.
Oh, I doubt the doctor's required to, operate like that to keep their license or anything, but
I didn't know.
depending on the
I
practice,
mean, I didn't know they require like a test every 72-hour test every what year?
yeah, they're saying that this neurologist requires a yearly 72-hour EEG. That's an inpatient thing. I mean, you heard they got billed over 20
That's
grand.
long. That's expensive.
And that's definitely not a requirement for a lot of neurologists, a lot of doctors out there.
No, that's also usually hard to get. Is one of those.
Already saying
It's
they live an
like a
hour
week
away, so
long study, and those are hard to get. The only reason I got that was because what?
what I remember about the EEGs too, those inpatient ones, is that I was always told to try and have a seizure. So I would be not eating, drinking one bottle of water in the day before I went, and setting myself up to not take that last dose and try to have a seizure in the hospital. So those inpatient ones can be really annoying because there's a lot of pressure to have a seizure. So that can be why a lot of people in the comments are suggesting that this might be illegal. Withholding the medication, they're saying that sounds like it's violating something.
So what I missed something. I stepped away. So
Mhm.
the doctor is saying they won't give them medication until they get an EEG.
Right. This patient had a 72-hour EEG, got billed $20,000. Their insurance didn't cover it, essentially.
Mm.
And then they're on their last refill. They're living in a rural area, can't get to the office. So they put in a call to get the refill. And the doctor said, we'll give you enough medication just to last you long enough to get to the hospital to do this inpatient EEG, the 72-hour EEG. So they're literally withholding the medication, saying you don't get the refills until you complete the study. And
But they already paid for the EEG, or they
not
didn't.
EEGs, right? I think that's another thing that's stressing this patient out is that they're not mentioning anything about the billing. So it sounds like they're still in the same cycle because when they posted this, they said it was last April. So April, it's been over a year since they got hit with that last bill. If they're stressing about getting this done and it's been over a year, then maybe that's why they think that just the same thing is going to happen again. If they got billed for the last one, even though it's been over a year, not a different policy, they're probably going to get billed for this one too. But apparently, this doctor is saying it's required to get their meds.
That's crazy.
Yeah, that's what a lot of the comments are saying too. What were you saying, Luca?
I don't remember.
Yeah, it sounds like a lot of people just agreed with that being unreasonable, to say the least.
Yeah, I know my
But
doctor,
not
he
all
would
doctors
not
have to operate
increase
like
it.
that.
Yeah. He
I
wouldn't
mean,
increase
they
it, but he did. I mean, he did let me have my medicine.
didn't let
But
me
he,
have my. I have. Oh, I'm sorry.
oh, go ahead.
No, you're fine. Go ahead.
No, I was done. I just was saying
Okay.
my doctor wouldn't increase my medicine until I had another EEG. But he did let me have my medicine. He didn't like withhold the medicine.
Yeah, I had to basically like fight to stay on the Klonopin just because nothing was coming up on the EEG. But at one point they had me on 0.5 and I would have to cut that in half and have
Just to make it last.
5 once a day,
Okay.
which did nothing. Honey, what?
And here's somebody else just looking for support. It looks like they're saying spitefully quitting nicotine. The time has finally come. I'm getting on my own health insurance through work, and I saw a tobacco attestation, $25 extra a month for being a smoker. I think not. So I'm ready to quit vaping. I've recently gotten medicated on Keppra and diagnosed with epilepsy after 3 tonic-clonic seizures in 5 years. It's been a long road with getting diagnosed, so I won't go into it. I've been vaping for about a year, and honestly, it's kind of lame, expensive, and I hate it when the vape juice touches my lip. Yup, yuck. I'm nervous to go cold turkey because seizures, obviously. So I'm chewing the gum, and it's gross, but it needs to be done. I'm in therapy to deal
Honey,
with the hard
the
emotions that
fuck
got me
out.
vaping to begin with. It's
Oh,
not
I'm
an
sorry.
overnight fix, but we've made some progress. Anyone have any issues with the gum? Any tips? I'm determined not to pay extra for the health insurance because I'm being dumb with my health and money. Also, my husband has been vaping for a while, so if anyone has any tips on quitting while their partner, roommate, or friends are not, please share. Anybody ever had to get off of nicotine?
Sorry for yelling.
Always entertaining.
That my cat ate food, so he's happy run.
Aw,
Um,
shows you the joy.
I quit nicotine and I did it cold turkey. Sorry.
Nice. No, that sounds hard.
It Yeah, well, I still smoke weed. So,
Okay.
but nicotine makes me feel sick. It makes my seizure threshold lower. I don't like it, and it's been one of the best things that I've got like cut out of my life. So from one prior nicotine addict to another,
It'll be worth it.
it's the best thing because it like genuinely I feel so much like healthier without it.
That's
It
better.
feels yucky in
Yeah, that sounds better. So overall then, when you wanted the cigarette, was there physical symptoms that actually wouldn't come on? Was the headache not as bad without nicotine if you rolled one or packed a bowl?
if I what?
If you packed a bowl or rolled one, you said you kept smoking weed, so I was wondering if it was actually easier to get off the cigarettes with a joint instead.
I like joints. I used to smoke like blunts, but the wraps kind of give me a headache. So I like joints. I like bongs, but I just like weed regular. But I don't really like cigarettes or vapes.
Hey, at least you did it. You quit the nicotine and didn't go back.
Yeah, I still
Good
smoke the
job.
THC vapes, but that's
All right,
it.
so on this one now, this is probably something we used to think about. Hey guys, hoping to find others who might understand. About a year ago, I had my first ever seizure. Some might recall my previous post for more. Okay. But before it, I had jolting movements causing confusion and involuntary actions. These worsened, leading to my left temporal lobe epilepsy focal diagnosis, though it wasn't definitive. I'm 20 and still no driver's license. It's tough, especially with my parents and other constantly shaming me about it, making me feel even worse. Even after just one seizure, I'm genuinely hesitant to drive. I'm on Devalproex and lacosamide, working with my neurologist on dosage. I still have moments where I don't feel entirely normal, making me question if I'm ready to drive safely. I know it might sound dramatic after a year, but this is a real anxiety inducing fear for me. For those who drive, how did you decide you were ready after your first seizure? Do you ever feel 100% normal and confident on the road? Any advice would be great. I would say to this one also, don't ignore your fears. That I think they're feeling that hesitancy to get their license for a reason. What do you think, Lupa?
I mean, I was pressured by family and just like peers around me to get my license a lot, but I never felt comfortable because of my myoclonic seizures, and I was undiagnosed for up until now. So, um, I'll never have my license, but if you're having the myoclonic jerks and whatnot, and they're persistent, it's best not to drive, in my opinion, because of the confusion they cause, and they're painful, and because of how you jerk, you could literally swerve the car into like off a bridge or into oncoming traffic or into a crowd of people, like, or you're
And that's even while being aware. Like you're not
yeah,
always
like
unconscious for those.
it's a quick jerk, but like it could cause, and instead of like seizing and being out of it, you're like confused after, and so people are gonna be like, what is that, and try and fight against it and whatnot. So I would suggest asking your neurologist about myoclonic seizures specifically, junior myoclonic seizures specifically. But
Yeah, that makes sense.
if they're upper body, which it seems like, they can be lower body too. For me, I had lower body ones that made me collapse, but typically they're upper body,
Mhm.
and you're aware for them.
Is it your arms? Do your arms flail out?
Usually it's your arms. It could be, for me, it's my entire,
Torso, right?
yeah, it's been like it got to like my entire body.
Wow.
So I would say that I had a severe case of it's junior myoclonic epilepsy because my brain's still developing, and I believe it cut off ages 20, but it could be 25. I'm not sure. But um it got to my whole body. It got to my legs. It got to my feet. Or not my feet. Oh, well, it got to my ankles. But normally it's up in the upper chest up region. It's like my neck, head. It could even be my eyes, eyebrows, nose twitching, my lips, just like a lot of little twitching I have still that aren't as painful, but if they were to come on full blown, then they'd be really painful. If I didn't have my medication, then they would be very painful. I'd love to give you guys a example one day, but
No,
can't
it's
do it.
okay. I have had those. That's why I was asking you about your arms. Do your arms flail out? Because my torso jerks like forward. It's more so like one side, my shoulder, and my arms flail out. So I would actually sit on my arms if I was sitting next to my husband in the car, so didn't hit him.
Yeah,
So did you feel when they were coming? Did you get an aura for that?
It's hard to say.
no.
It's almost like you're about to sneeze.
Yeah.
That feeling that you get in your body when you're about to sneeze. And I think that's why it's dangerous to drive, because I don't know if everybody gets an aura right before.
I don't. For the myoclonic jerks, I get no aura. They just come and they are aggressive.
Yeah, yeah.
And if I was driving, it would be really dangerous because I wouldn't know what to do. Like I wouldn't know if I would take my foot off the gas, if I would hit the what if I don't know what I would do. I would just because I'm so out of it. It's like being awake for a mini seizure, a really small mini seizure. It's like being awake
Mm-hmm.
for that.
Yeah, that's not really safe.
Yeah.
I agree.
I will be back, you
Yeah,
guys.
I'm actually gonna head out.
Oh,
I
okay.
have to
All
go. I
right,
was about to
thanks
say
for
that.
stopping in. No, totally happy to have you.